Continuation of the special meeting of April 1st, 2019. Welcome. Welcome. You have the floor. Just your name and title, and you have the floor.
Okay.
Welcome.
Thank you. I'll wait just a second to make sure we're on there, since I can't do two things at one time. But my name's Patrice Sulik. I'm the Director of Health for the North Central District Health Department, and thank you for having me, and thank you so much for giving me more than the normal amount of time so we could try to go through your questions.
Yep. You want to do this?
And just start whenever?
Yeah, go right ahead.
Okay, so first I wanted to thank the board members that are here. We have two Enfield board members in the back, Marianne Turner and Linda DeGray. And then we have a couple of other board members, Maria Weldon from East Windsor and Bill Meyer from the town of Vernon as well. So nice to have.
Welcome.
Nice to have people on board. And a little bit of an overview of what I did. I received all of the questions. And so I tried to put this together in an order based on what I thought the priorities were in case we run out of time.
Perfect.
Some of the data sheets were very, very dense, so I tried to translate them into slides. And tomorrow what we'll do is I'll email a copy of the last audit, a copy of the presentation, and a copy of all the supporting data sheets to Deb McCarthy.
Perfect. Right.
And then she could distribute them out. And so if we run out of time, at least we've hit, hopefully, the more important topics. I'm going to hope that I don't do a lot of coughing. Would you like to ask questions per slide?
Or how would you, your call?
To me, we change subjects so much based on the questions that I think it would be
Perfect.
better so people don't have to wait till the end and then we
Okay.
go back. So
Yep.
if that works for everybody here, then I apologize having my back to me.
Yep, no problem.
Okay?
Yep, thank you.
Great. Okay, so North Central District Health Department. A little background for those, I knew some of you have heard this before, but in case you're not aware, in Connecticut currently there are 66 local health departments. That's down from 69. And the breakdown is as follows. 20 districts that serve a total of 123 of Connecticut's towns, 33 separate municipal departments, and 13 part-time. Maybe about 6 months ago, it was 16 part-time, but 3 of those part-time towns have joined health districts in their area. The state is really at least trying to focus on having the part-time health departments either gain full-time status or join a health district. Unfortunately, they don't have the funding to really incentivize that in a meaningful way. Local health departments are funded through the state, through the member towns or municipalities, and from permits and fees and licenses. And in case people haven't heard of this, we're tasked with providing the 10 essential services. And I'll just show you briefly, and then again, like I said, tomorrow you'll get this in an email. These are the 10 essential services that the state adopted approximately, I think, around in 2015. And this is a national standard that kind of came about in the 90s when there was all the talk about health care reform. In addition to health care, it was explored what's the appropriate role of a local health department. And so, as you can see, enforcing laws and monitoring environmental health is a piece of this, but it is not at all the whole picture. The North Central District Health Department was founded in 1974. At the time it was founded, there were 4 member towns. Enfield was one of the first towns, of course. East Windsor, Ellington, Enfield, Windsor Locks. And then over the years, 4 additional towns joined. And what seems odd to people sometimes, I came into it, so I just accept it as it is 7 of our 8 towns are contiguous, and our town of Windham is geographically discrete and separate from us. So, but we have an office, a field office there. We currently, even with some small towns joining health districts, we still currently serve the largest population for a health department in the state of Connecticut, approximately 166,000 people almost. That does not include our daytime population, which in Enfield there's a big daytime population that comes here to work and do other things. Our main headquarters, as you're aware, is in Enfield. a stone's throw away. And we have 3 satellite offices, one in Stafford Town Hall, one in Wyndham Town Hall, and we have a small office not in Vernon Town Hall, but in a Vernon-owned building that is an enterprise building for them. We have office space and access to a conference room there. The health district is comprised of a 21-member board, and I would say, I kind of compressed this so we can get to the questions. I would say if you want to think of us as far as divisions, we have administration, environmental health, community health, and public health preparedness. Just stop me whenever you have a question. Moving the district forward, I was hired in 2016, and the board really tasked me with conducting a thorough assessment of all the operations in the district and kind of creating a plan of what I felt were priorities that should be addressed. I want to say one thing that was interesting in 2016 when the board was seeking a director was that they initially had even spoken about national accreditation for the district. We decided as a group that we weren't ready for that yet, but what that said to me was that the board was very aware of kind of the national landscape and what the role of a health district should be. And I've always gotten the impression from the board that they don't want this kind of limping along, just getting through the day kind of agency, but that they wanted the agency to be really robust in serving the constituents. A couple of things, and again, I've just touched on some major points. My first thing in the door was really taking a really close look at the finances and the budget, and exploring the frequent staff turnover was another priority. I think when I came on board, there were 3 sanitarian vacancies and a part-time health educator vacancy. So I will say the biggest surprise was I continue to spend a lot more time interviewing and hiring and onboarding staff than I had anticipated. All right, a lot of the questions focused on budget and finance, so I've started there. It's not a complete picture because I focused mainly on the questions, but I'm happy to answer any questions that I can off the top of my head. There was a question about state per capita funding, and I kind of liked the wording of it. Is the state doing its job? Well, as we all know, the value of the dollar is not increasing. And so from 2010, the per capita rate, or prior to 2010, it was $2.08 per capita for health districts. The state was working very hard at that point to really incentivize forming districts and trying to squeeze out efficiencies that could be squeezed out. In addition, they didn't pay as much for municipal health departments or part-time health departments. So in 2010, that rate was decreased to $1.85 per capita. And that's 2010, and now it's 2019. So you could kind of extrapolate, you finance people on the council could extrapolate what you believe that $1.85 that was worth in 2010, what that's worth today. In addition, they keep
How often do they review, or is it a yearly per capita change, or has that been consistent?
No, I haven't.
Okay, sorry, go ahead.
See, you're tracking with me. The next slide will cover that. But in 2010, what they also said is if you don't serve 50,000 people, or as a health district, if you don't serve 50,000 or 3 towns, you're not getting any funding. And if you're a part-time health department, you're not getting any funding. Now, people could feel differently about that, but in my world, directors of health think all of the taxpayers in Connecticut pay for this, but only some of the towns are getting the benefit of it. But again, they don't have the money to incentivize forming health districts or working units that the size makes sense.
What's the state's definition of a part-time health district?
A part-time health district has a part-time health director and a full-time sanitarian.
Okay.
Wait, but you're hitting on a good point,
Yeah.
because we know one town that's simply they're not going to change anything except their full-time sanitarian is getting her master's degree in public health, and then they will be called a full-time health department, but it won't increase their service ability at all. And so there's sometimes the statutes aren't written in a way that really helps us. So more disturbing is, in recent years, the $1.85 has not been consistently funded in full. And I think maybe this year in the legislature, as they're trying to, or it was last year, they were trying to have the conversation of, well, let's just remove that $1.85 from the statute and say, we'll kind of think of what we think we should spend on it and then spend that. So there's, our Directors of Health Association has, someone up at the legislature kind of tracking bills for us. So I'm not sure if you can see this really clearly. It's just a little bit of a history for the last 5 years on what they've funded in the per capita. So fiscal year 2016, they only funded about 95% of it. Then it went even lower the next year. Fiscal year 2018, all of a sudden they put the funding back up to 100%, but as a part of that, they cut all lead poisoning prevention funding. Now, for North Central, it was pretty much, there were pros and cons. It made us whole, and it gave us more money, not in a specific bucket, because our per capita, we have a broader array of things that we can do with that funding. But for cities that have really high lead, we don't have low lead, but for cities that had a high lead that maybe got like almost $300,000 just for lead poisoning prevention, it really, really crippled them significantly. So it didn't have the same effect across the board. In the current fiscal year, they funded us at about 89%. I think we anticipated very conservatively at 88%. And the initial governor's budget that came out was talking about funding it at around 80%. So very disturbing to us.
Any questions so far? And that 185 is per health district, so it's not, is it different between north or west or south or east, or does everyone pay 180, or approximately get 185?
$1.85 per person according to their census numbers in that particular
So
district.
it's consistent across other health districts within the state?
Yes.
Got it. Okay.
And then also municipal health departments, they get less, a little more than $1. Part-time get nothing. Okay, district town per capita rates. Again, I'll send you a whole sheet because it's just interesting to get context on where we are, but just a couple of key points. The per capita rates across the state range from $4.67, which is us, and $20.79. So I think the $20.79 is probably the Newtown Health District or Westport Weston Health District. Westport Weston is 2 towns, less than 50,000. They don't get any state funding. When I looked at the rates, you'll get a sheet that shows the rates from the smallest health district all the way through the largest. You'll notice that there's some correlation between districts with more individuals having lower rates, but it's not an really, really pure correlation, but there is a little bit of association. Looking at the numbers from the last 2 years, more than half of the health districts had a rate increase over the past year. Some of them were significant. I think, for several years, the board's been very, very focused on keeping a really close eye on the finances, and I think that that's been a huge benefit. We've held our current per capita rate for 5 years. We're not interested in raising the rate to raise the rate. The history of the health district tells me that the big brag used to be it's the lowest per capita in the state. Do I think that's sound planning? No, I don't. But I came in 2016, and we'll keep trying to move it forward as carefully as we can. Just to give you a little more context, other departments similar to our size, not as big as us, but there's a couple of departments that are close to our size, and they have really, really robust community health programs. Like, I would look to them as an example for what I would like to see as a community health program. And just so you know, their per capita rates were between $5.5 and $7.30, and they have pretty well established community health programs, which to me was one of the things that was really missing at the health district. Any questions?
Anyone have any questions? No. Thank you. No.
Okay. Okay, this question related to I was asked for data about revenues in the health district, grant-funded revenues and general fund revenues. And so had them all on one page. It was really messy, so I tried to separate it out. Hopefully it makes sense to you. So just showing the last 4 fiscal years and the general fund revenue trending slightly upward, not hugely upward, but trending slightly upward. And then I can back up if you need me to after I show you the other slide. Grant revenue, which is kind of a little more interesting over the past 4 years. And what happened between fiscal year 2015 and fiscal year 2016 is that you'll see on the very top line where it shows preparedness funding, there was a model the state used to fund local public health for public health preparedness funding when it first came that was not tied to per capita. Now, whether there was a good reason for doing it that way or not a good reason for doing it that way, all of a sudden they decided to make a change. And the biggest impact was to North Central because we have the biggest population. And so we more than doubled what we had in public health preparedness. It didn't go well in this region of the state because I think there were many health districts that felt that North Central wasn't always pulling its weight in the preparedness area. And with preparedness work, whatever you're not doing, somebody else is going to have to step in. And we all work closely together, but it was kind of a very negative sticking point. It happened before I came. So you see the funding was stable, and then you go to the right, and the preparedness funding decreases a little bit. That's because the CDC, Centers for Disease Control, said that you have to work through a healthcare coalition now. So DPH is not, state health department's not going to fund you directly. You're going to choose a fiduciary for your region, and you're going to get funded through the fiduciary. And the fiduciary has some, they have some specific duties and responsibilities, so payment for some of that came out of everybody's allotment of money. The good news is that we're about to sign on, starting July 1, for another 5-year preparedness funding cycle. So that's the story with the preparedness money. It shows when we didn't get the lead poisoning, prevention funding, and then a newer grant is one to combat opioid abuse. And so it's kind of a little bit up and down, which isn't unusual for grant funding.
So the preparedness, who is the fiduciary?
So we are in Region 3 and Region 4 for preparedness regions. And so since the airport's in Region 3 and most of our towns are in Region 3, we decided to go with Region 3. And it's CROG. So
Fiduciary.
Yes.
Got it, okay.
And the nice thing about that is a lot of our towns belong to that, so there's no concern at all about the funding not going where it's supposed to go, to local public health.
Sorry, Deputy Mayor Suzanne?
So, I don't know, I guess with the opiate, how does that coordinate with what the town provides through its social services? Do you do any coordination that way? I guess that's...
Absolutely, and I talk a little more about it later, but in short, it enabled us to make our part-time health educator full-time. And it, more than anything, this funding has changed the face of the community health work we do because it funds a body. One of the biggest requirements of the grant is that we're engaging with all of our towns in the efforts that they're doing. So it wasn't like duplicate, replicate. It was come alongside and combine efforts and funding. And I'll talk more about that
Do you have
later.
a full-time grant writer on your staff?
No, we do not.
We do not, okay.
Dare to dream. Okay, and then just adding the revenue together to see a little bit more of a trend, again, trending a little bit upwards. I'll refer back to pieces about this that relate to grant funding, but are there any more questions?
Any questions so far from anyone else? No?
Okay, talking specifically about grants in the current fiscal year, and something I'm kind of excited about is that I feel like the State Health Department is looking to coordinate and collaborate with us more now than possibly in the past. So the opioid grant we received, not because of any great thing that I did at all, it wasn't competitive, even though we had to apply for it, but we were invited to apply. And I think what it was is they really looked at health districts, because we reach more people and we serve more towns. And they looked at the target towns for where they were seeing the overdose deaths, which we're in really, really seriously bad shape if the way we're tracking what's supposed to be prevention work is we're looking at death data. I mean, it should be, I know it is on everybody's mind. It's very, very disturbing. So in our health district, Enfield, Vernon, and Wyndham were what they labeled target towns because of the data they were seeing. So that funding is for 4 years. The nice thing about it is we have to use the change the script kind of marketing material. That was a part of it. We weren't to make up our own marketing material. But the nice thing about that is that the state also did like billboards and things that we wouldn't have been able to afford with our funding. And so it's kind of like combining everybody's efforts. And the 4 health districts that got this grant, right from the get-go, we said, let's get these public health educators together, let's divvy up tasks. And so we were able to squeeze a lot more value out of the money than if we were just working alone. And we're supposed to get an extra kind of $32,000, but still waiting on that. So we're not making any plans to spend it until we know for sure.
No federal money's flowing in from the federal money that was out there for the opioid crisis?
Yes, through the state. This is funding that's flowing through the state. There was a grant opportunity about opioids out, but my health educator reported to me that bigger collaboratives were already going for the funding. And so for any of you that work with grants or on grants, it's not like back in the day where you could just apply, in your own department and get, say, $50,000. The big grants that are coming from CDC, which are the only really grants around, there's some foundation funding, but public health funding has really, in a large way, dried up. These grants are millions of dollars, and they want big collaboratives. So several of the health districts in the northern region of the state have formed what we call the Northern Tier Collaborative. We had a very high score applying for a different kind of grant for fall prevention among seniors. And so what we're doing is we're dividing the work. If a grant comes along that we know not any big partners are going for, we'll get together. We divide up all of the work, everybody does their piece, we put it all together, and, we get it out. And so that's kind of really, that collaborative is kind of in its infancy, but that's kind of our model that we want to go forward with. Okay, a couple of new grants. We were asked to be the fiduciary for the Putting on Air's home visit asthma intervention program. About $30,000, not a lot of money, but some other real benefits came from that. It's going to introduce us and have us work with community health workers. Has anybody heard the phrase community health worker at all here? It's a big part of the SIM project, the State Innovation Model for providing medical services. And so doing this, we do it for all of the region, our towns, all the way over to the eastern part of the state. And it really puts us in a leadership position in the state, which we can leverage to do future things. So I'm really excited about that work. It flies in the face of most public health work in that we don't do a lot of individual work. It's all for like community prevention or community health promotion. And someone might say, well, what if you give someone a flu vaccine? We give a person a flu vaccine and we know it's going to hopefully protect them. Some of us this year not so lucky. But what we're really doing when we vaccinate a single person is the goal is we're trying to protect all of the people they come in contact with. So the Putting on Air's indoor asthma program is very different than most of the work we do. But again, it's a opening into working with community health workers, which are a big part of the state innovation model moving forward and may really open other doors for us if we're doing this work. So we're excited about that. We were also and we were invited to do that. They're like, we think we don't have a fiduciary in this region. We think you would do a great job. We said we want you to change the lines so all of our towns are included. We don't want somebody else serving our towns if we're doing it. And so that was great. Another, the state was able to get a small lead poisoning prevention grant, and there wasn't enough money for them to pick like their big cities with heavy lead. But they said, we want to try a model of working on lead poisoning prevention on subsidized housing. And so they said they chose the people that they knew they could count on and that they work well with. And so, again, it's a little more funding, and part of what our contractor's doing with the funding is she's using it to look for possible other lead poisoning prevention grants. So we're trying to squeeze all the value that we can out of it. There were questions about the budget, so I wanted to just talk a little bit about the budget process. Our fiscal year, of course, is July 1 through June 30th. The budget process that we do, probably somewhat similar to yours, it takes several months. The only part that worries me about it, which we try to fine-tune, is that we really start in October. And in October, this is what you do. We're guesstimating so many more things. And then the goal is a public hearing for our January meeting where we plan to vote the budget. And so, we're still really early on before the year. Our approach to budgeting is that we estimate revenues very conservatively and we estimate expenditures very conservatively. I feel that my responsibility as a director is I really don't ever want to be in a position of going back and saying, well, we didn't get enough money. I mean, to me, that would be terrible. It's not that we're trying to generate so much excess, although I have other slides about that here. It would make sense for a budget our size for us to have $40,000 a year that we could kind of keep rolling back into having kind of your emergency fund or your fund balance. The Finance Committee, the last couple of years, I feel like they have a great approach. They held workshop sessions. All the board members are invited, and before they push a final budget forward, everybody has the opportunity to bring their concerns up and talk about them. And so I feel like it's one of the things we do that really involves everybody and is a good process. Obviously, some line items are more challenging to estimate. And for the size we are, as compared to the town of Enfield, say whatever our health insurance is, if we have one person leave who doesn't take our insurance, and they're replaced by someone who's going to insure their whole family, that's like a big, that's a big hit on our budget, where town-wide, with the number of employees you have, that wouldn't be, that wouldn't be such an obvious thing.
What is the underlying health insurance you offer? Is it a PPO, HMO, HSA?
We're going to get to that.
Okay.
See? Reading my mind.
All right, thanks.
So, something like that can really throw off the budget. Obviously, as I'm sure you do, we work with our liability agent to try to say, what do you estimate? Where, which lines are going up?
Do you know your trend? What's your trend for medical insurance over the last few years? Do you have that as well?
Yep. And I'm not sure if the exact details are in my slides or getting emailed to you tomorrow, but we have a lot of data on that. Are we good so far?
Sorry, who's your carrier?
Our carrier currently for
Health insurance.
For health insurance is the state plan.
Okay, you're in a state plan. Got it. Okay.
Since December 1st. Okay, so to focus, you didn't ask specifically, but to focus a little bit on expenditures, and I just grabbed a few examples. Having really not seen the budget before, when I came on board, for me it was easy, fresh eyes, look at things differently. We were able to achieve a lot of cost efficiencies. What I like to achieve is value. It's one thing to talk about what something costs. It's another thing to talk about, well, if you're paying this much, what are you getting for that money? So a couple of things we did right at the beginning. We saved significant money on the audit. I think that previously they might have been paying around $17,000. We've now been paying about $9,000 or $9,500 a year for the audit. what we do is we're currently working with an auditor who does several health districts. He does some small municipalities as well. But because he works with health districts, he knows what all the grants are. He knows, so it's, some of that is he can do a little more efficiently than someone who only works with us as a health district. We removed the need for an outside accountant to perform routine work, so I think that was maybe another about $10,000 to $15,000 in savings. We maximize savings on our agency cell phones by really tracking the cost and combining the shared minute plans with, to maximize what we can save. And we did a comprehensive study on everything we purchase, the office supplies, the janitorial supplies like paper towels and toilet tissue, pump dispenser soap, and also field supplies for our sanitarians. So we kind of spent a lot of money at the beginning, and I don't know what you found here. We've tried everyone, but hardly anybody can beat Amazon ever. So most of what we get for office supplies is from Amazon, and much cheaper than Staples Advantage, much cheaper than WB Mason, except for the copy paper, of course, because of how heavy it is to deliver it. And one of our board members put us in touch with the janitorial supply company that the town of East Windsor uses, and so we were able to achieve some good savings there.
Is that a cost study, your inventory? Is that kind of what your inventory is year to year over? I mean, is that where the cost study was? Knowing what your inventory is? I understand going to Amazon and purchasing, but what if you don't need the product, for example? Do you understand your inventory?
Oh, yes.
Yeah.
Yeah, well, it wasn't done there wasn't a systematized way to order before.
Okay.
So now we basically order quarterly, and we've been able to even fine tune it so we know what our use is going to be for the most part. And for some of the sanitarian field supplies, we realized that one of the companies we have to use, this is just a small example, but when you pay attention to it, it adds up. So they charge us $7 shipping, no matter how little we buy, no matter how much we buy. So after we tracked everything for a year, we said, okay, well, we have a sense of how much we need for the whole year. So order once, then you're saving that $7 the other 3 times of the year. And I mean, again, we tried to be very vigilant about it, and then we had to pull back and say, okay, let's not spend $10 of time to save $5. But I think we got into a good place, and everybody has this mindset of, oh, how could we do this less expensively? We had a couple of issues with some remanufactured ink that didn't go so well, but we try. We do what we can. Talking more about general fund expenditures. So some questions were asked, and I just highlighted it here. You'll get documentation that has more data on it. Is that what portion of salary, taxes, salary, wages, taxes, benefit comes out of the total fund expenditures? So you just see for 2018-19, it's about 77.29%. In 2019-20 is about 79%. There's a couple of reasons for that. To me, the employees are the absolute most valuable resource that the district has. If I had to, we could do the job without iPads. It'd be really hard for any of us to live without regular computers in this day and age. But the employees are really the valuable asset. The other thing, though, is that we've done some pretty good economizing on the expenditure side. And before my time here, the board had purchased this building. They don't have a mortgage on the building. So we don't have a line for rent, really, or a mortgage for the building. Any questions?
Any questions? Carl.
I have some budget questions here and then some general questions.
Go right ahead.
Okay. So under the well, first of all, let me back up. I know that this fiscal year you had employees that received double-digit increases in their salary, 10, 12, 15. I think I saw 18% for somebody. And I understand there was a little notation that said you had a wage study done. So I guess the question is, and I agree with what you said about your employees, because on our side, they're our most valuable asset. And I think everybody here would like to give our employees 12, 15, and 18%. Never going to happen. I don't understand how in 1 year you were able to give those extraordinary raises. Is that put you now, from all the other health districts, are you in the middle now or the top, or?
And I have more slides about it, but just to answer that question, it did not make us competitive at the top end of the range. It put us right in the middle. And as to those percentages and those numbers, I had a sense that we weren't competitive, but I was horrified, quite frankly, to find out how not competitive we were. And I have some other slides that'll show the data in a different way. The amount of revolving door and the way that our health district was looked at, it's, you know, and I also conferred a couple of times with, we have a HR director on our board. And what you need to also measure, and I'm sure you do this too in the town, what you need to measure is how much lost work, how much work is not getting done because you have vacancies, and then how much work is getting spilled over to the other people who now they don't have a competitive wage, but now they don't even have a competitive workload. And then when you're spending all of this time advertising and all of this time interviewing, that was the most thing that took me aback my first year, was how much time I spent.
I certainly understand that. That makes sense, that you want to offer a competitive wage to get good people. I get that, retention and everything you said. But was there any thought of phasing this in over a couple of years instead of slapping an 18% raise in 1 year?
There was a thought, there exactly was that thought of phasing it over a few years and then the conclusion was, we're going to be lagging behind so much that maybe part of our current pool of employees, particularly sanitarians, but not only sanitarians, is that they're not going to wait 3 years. And I can talk a little bit, if I'm not digressing too much, because it's actually pretty interesting, is that what was typically happening most to North Central District Health Department with people leaving and not being able to fill vacancies, only in the last year has started to happen to more and more of the neighboring health districts that we collaborate with on things, to the point where it's getting to be a big problem. For those of you who are not aware, the state has adopted the FDA food code, which is an extraordinary change over the food code in place, although again, anything that's a national standard generally makes more sense. It hasn't really gone into effect yet, but when it goes into effect, there's a whole kind of layer of people within a couple of years of retirement who are like, well, you know what, the state might delay it a lot, but as soon as it comes, I'm out. Not only is that going to leave a lot more vacancies, but we're not even going to have those retirees to pull for and say, hey, work for us 10 hours a week, work for us 15 hours a week, because they're not interested, not all of them, but some of them, they're not interested in getting retrained.
Okay.
And applying a new code.
All right, just real quickly, one more question. You mentioned that you want to be conservative with your expenditures the best you can. So with that in mind, when you switched auditors, right, you said, did you go out to bid for that?
Yes, we did.
And did you do that with the janitorial services too?
No.
You didn't? Okay, thank you.
Councilor Bosco.
What was the average length of employment for your employees?
I don't have an average. What I can tell you is that, are we talking about mainly sanitarians?
Well, you're talking about turnover. So what,
Yep.
was it a year? Was it 5, or is it 5 years? Is it?
Good question. So with about the 7 or 8 sanitarians that we had, and if you count me, we had 3 with more than 30 years of experience, and then we had everybody else for sanitarians.
No,
with
I'm
less
not
than
talking
5.
experience. Like, we know you've been there, what, 2 years, 3 years?
3.
3 years. So we know there was a turnover, but your turnover was because we had a retirement, right?
Right.
So what I'm saying is, out of your sanitarians, what was the turnover rate? You're just talking about losing a lot of people because the pay was low. So what was your turnover rate? Was it you know, a year for a person? Was it 5 years, or do you have an average of 20 years that someone's been there? Because I know most of your people have been there for a long time, and that's why I'm asking.
Not most of them. The other senior management staff have been there for more than 30 years. And when I first came on board, there were 3 sanitarian openings, which is a lot, and a person with about 20 years there left shortly after that. But most, to your point about how many years do they stay for 2 years. I'll tell you the magic thing about 2 years. Nobody can get their foot in the door in this field because you can't get field certified to conduct food inspections until you are working for someone. And nobody wants to hire anybody that's not already certified
Right, but
to
what-
conduct food inspections.
But what is the average that, you know, that, like, I can tell you this much in a body shop, if you get 3 years out of someone, you're doing very well, because they move. So it doesn't matter what you're paying them, they usually just move and keep going on. So historically, what is the average person staying?
The turnover seems to happen right around 2 years, 2 to 3 years. And I don't know, I can't speak to the body shop and what that kind of experience is, but with sanitarians, you bring them in the door, there's hardly anything they can do alone for about a year. And then they still need an awful lot of guidance for about 2 years. After 2 years, they can become registered sanitarians generally, and then they can go anywhere. So what you had is the health district didn't have a good pool of applicants to choose from, so they were kind of being, you know, pressed into hiring people that live really far away, so far away that you know that as soon as they get that registered sanitarian under their belt, now they're looking closer to home. Not because they don't like it there, but because they can make more money and save commuting time, which also costs money. What should happen in a department our size, is if you consider like a bell curve of experience years. In most departments, you would expect to have, so we have 10 sanitarians, including Deb, Michael, and myself, which we don't do primary sanitarian work. So you would expect to have maybe 1 or 2 above 20 years, and then you would have a normal distribution where maybe you'd have one at 15 years, one at 8 years, one at 5 years, and then maybe you would have one person that's a brand new baby sanitarian. But you would have all those other people with more experience that could also help train that person. Instead, what we have is 2 senior management and everybody else practically with less than 5 years experience, which, you know, creates a lot of backup of work, creates you being in situations where you're sending out people who really don't have the experience to do some of the work that needs to be done. So, and again, I can't speak to doing body work on cars.
Councilor Castati?
Okay. What I'm hearing you say is that in regards to your salary study that you did with other districts and comparing the North Central Health District to other districts in the state, so you came up with a proposal and X amount of percent that you were going to have a better salary rate for your employees, okay? So, and I can understand that, because not only are you experiencing that, but we are experiencing that within our town. In order to keep good employees, in order to keep good people, in order to train people and keep the people, you know, that you want to have on your staff, you have to up your salaries a little. Now, your salary, how did your previous salary compare? And I know based on your study, and I know that you went up to, I don't know, 16, 18% increase. Now,
Depending on the person.
okay, so those sanitarian, right? Okay, so is that comparable now to other districts now, this increase?
It puts us right in the middle of the health districts only. Municipal salaries are usually higher, so we didn't use those. So it puts us right in the middle of health districts that when we looked at where we're drawing a pool of applicants from, other health districts that might compete against us for those people. It doesn't put us at the high end, it puts us smack dab in the middle.
Okay. All right, well, thank you.
Even
Yeah.
with those increases.
Okay, thank you.
Okay?
Go ahead, yep.
Ready to move on? Okay. Okay, I was asked some questions about staffing, just to give you a chart that just shows a little overview of the positions. It stayed, you know, the number isn't largely changed over the years. We currently have about 1.5 positions vacant at this point in time, and that's where we are with that. More detail on the next slide. The staff composition, so basically director, 2 senior management, 6 full-time sanitarians, 2 part-time, full-time public health preparedness person, health educator, a public health nurse at 30 hours a week, and then our admin staff is along the bottom. And this is from fiscal year 2018, so it's maybe a little slightly different now. I want to talk about, any questions so far? Or should I keep going? Someone will have to give me like a 10-minute buzzer, because I can.
Yeah, you got 10, I want to make sure we get to the benefits. You have 10 minutes.
Oops.
Yep, go ahead.
Okay, we'll go, I'll try to go fast. So again, we've already touched on the subject. Frequent staff turnover was identified as a major concern. The result at the time I came on board was a significant number of staff with less than 5 years' experience. Non-competing wages and benefits were, were brought up as the cause, and it was a priority. We did the benefit and wage study, and if it has value, it's a lot of data. Do you want me to include that
Yeah.
study?
Yeah, I'd like to know, we want to know what the benefits you're paying your folks compared to what we are.
Sure.
You know, I mean, what is it, a PPO plan, is it an HMO plan, and
Yep.
what is it?
It's next.
Okay.
It's
yep.
next. Okay, we talked about the wage increases, so I want to get to the benefits. Health insurance, currently, we're in the state plan. It's not a high deductible plan. The employee pays 16% of the premium cost. Last year, we did switch to a high deductible plan. And what has happened over 4 years? Well, I'm sure you're aware, although maybe your plans aren't as volatile as ours, but we were seeing going from Aetna, which pulled out of the small group market. We went to an Anthem plan. Then we had like a 20% increase, so we went from a gold to a silver plan. And then there was going to be a 30% increase, so we went to the high deductible plan. And then the state plan, which had pretty much been considered out of reach, was actually newly again considered to be in reach, because it would take us out of the small group market,
Right.
which is what's so volatile. I know in the past, the health district was getting insurance through the town of Enfield, but I had the sense when I first came on board, they were not interested in doing that with us, which is fine. The average, over the last 5 years, the state insurance plan has increased by approximately 5.3% a year, and I'll send you all of that in the
Yep.
data. And ours were like 20%, 30% increases. In addition, I'm not sure you're aware, but in a small group, you're rated by age. So that would throw off our calculations even more, because each person on the insurance was rated by their age.
Right.
Dental insurance, the employee, we have that through Anthem. Employee pays 12%. We have life insurance and disability insurance paid by the health district. Our pension is the district at the end of the fiscal year, if you're present and you've worked 1,000 hours, scheduled hours, you get 4.5%. That's actually pretty low compared to
So
districts.
does the pension follow the employee? So if the employee, you said you had a turnover, so what happens to the pension when the employee leaves?
It's a defined contribution, so and we have a 5-year vesting plan, so 20, 40, 60, 80, 100. We have an optional,
Deputy Mayor Suzak?
sorry,
Do you have a 401K for your employees to invest in as well?
yes.
Okay, thank you.
And there's vision insurance that's paid 100% by employees who want it. Tuition reimbursement up to $1,000 a year for courses that relate to the person's position. And our paid time off, I just noted it here for you. What's very different from us and most other health departments and districts is that vacation time taps out after you get to 3 weeks, you can't get any more. That's something that kind of stands out. And sick days, we were given a limited amount per year. They put in the short and long-term disability so that we wouldn't have all of this potential expenditures, or, you know, when people would save up. I don't know what you have here, if people could save like hundreds of days or something like that. So you get them, they're just for defined purposes, and then at the end of the year, the beginning of the new fiscal year, you get 12 more.
Any questions? Carl, sorry.
Your sick leave policy, do you have a sick leave policy?
We have 12 days.
No, I'm not asking what benefits you have. I'm saying, if employees use all 12 days, you don't have a policy that governs anything about anything, that they can use them at will?
They can use them for being sick, so there is a sick policy that clearly says what they're for. They can also use them for medical appointments or family sick. And they have to bring a note if it's 3 days in a row.
Okay, so that would be the policy then.
Right, and there's something in it about, you know, if there's a suspicion of abuse of sick time. Is that okay? Anything else? I need to go quicker. Okay, we already talked about the health insurance piece. Good question about excess of revenue over expenditures, and when this was first brought up in a board meeting, it actually kind of proved what we believe to be true. So just showing, just in very general terms, over 4 fiscal years, you see the first 2 years, 95 and 97% of the excess of revenues over expenditures was due to vacant positions in the district. And I'm happy to say that that's decreasing. That's decreasing somewhat, and there's other causes. I'm going to send a copy of the last audit, and every year in our audit, it'll show what exactly the categories were that there was excess. Again, it's not our goal to have the excess.
Yep.
You know, a reasonable amount so you could keep kind of funding your fund
That just flows
balance.
into your reserves, correct?
Correct.
Yep.
So in general, a way to get information about us, our quarterly financials are given out. They're posted with the board agenda each quarter, and they're sent to all of the board members, and they're posted on our website, and they're filed with all of your town clerks. So you could just simply pull that up, and you would know exactly where we were by that date as far as where we are in our budget.
Councilman Bosco.
Your fund balance, or
Yes.
whatever you want to call it, what do you cap it at? What percentage do you want to be at to have a fund balance that's going to work for you, but not too much?
Right. I would say currently, I don't think there's any what I would want it to be at. That would be a whole board decision. But a couple of good points related to that are that they say the state recommends approximately 3 to 4 months of operating expenses. So I believe that there's general consensus on the board that $500,000 would be a good amount to have for that. The reason our fund balance is high at this point is because a couple of years ago, the board was going to embark on a remodeling project for the building, and because the Commissioner of Health had really put out that they were going to kind of force major regionalization of health districts, and that people weren't going to be in their own buildings, but they'd be in town-owned buildings, I think the board properly wanted to hold off and, you know, see where that was going to go. And we're in the process, I imagine you know from your Enfield board members, that they're in the process again of seeking out a project manager to help move forward on the building.
And what do you have for fund balance now?
Approximately $1.2 million altogether. $250,000 of that at this point in time is earmarked for the building.
So you're over by a good thing about $500,000, including doing the building.
No, because I think ideally, if you want to be really solvent, and sometimes that matters for grant funding as well, is that you would want to have that $500,000 that's, you know, your undesignated fund balance, that's kind of your emergency fund, and it would make sense for an agency our size to have a couple $100,000 so we can do capital expense plan. And I know Shannon Grant, one of the Enfield board members, is working on helping us put together a plan like that. And the board's being very mindful of trying to utilize the funding really carefully and keeping our per capita rate down. It's kind of the good result of people being really careful with the funding for so long.
Carl.
And just my last question. North Central Health District, there's 7, 8 towns, you said?
8.
All right, so Enfield would be the largest, correct?
Correct.
So then it's logical we contribute more than any other town. What percentage do you think Enfield contributes to your funding?
Oh, I
Half.
would have to, I can't, sorry.
But it's more than the other towns.
Correct.
Okay, so then is it logical then to extend that out and say, because we're paying more, are our inspection rates and services you're providing to our town greater than the other towns? Are there any programs you're providing to us because we're paying more than the other towns? Or are we getting the same inspection rates as the other towns?
I would say that you're getting very good inspection rates, and we don't view it as more or less paid. It's so we inspect the restaurants where they are, keeping in mind that Enfield constituents are eating in a whole range of places. One good thing about having our headquarters here is that there's significant supervisory staff, and so obviously because most of our staff is located here, we can mobilize very quickly in emergencies.
But you can't say that we're getting inspection rates at a higher rate because we're contributing more. That's not the case necessarily.
I can't say that it is or is not because that's not how we plan our
Okay,
work.
thank you.
Deputy Mayor Suzak.
Okay, so you get revenues from the towns, and you also get revenues for the services like restaurant inspections and things like that. So I guess the question is that are you able to do the pay increases that you've been able to do and keep employees there because you're getting more revenues from services you've provided, or has the increase come from the per capita increase that you charge the towns?
We haven't increased the per capita rate to the towns, and it's been stable for 5 years and will be the same next year. So I would say it's probably a sum total of being very careful on the revenue side and the expenditure side, if that's fair.
Is the per capita state, it's a state requirement, correct? So the per capita per the size of the town, is that based on state? So meaning our portion, is that based on the state's formula for what we?
Yes.
So then my question is, if the state is reducing our revenues, there's no tie-in to reducing some of the quasi-state agency that we fund into. So that's some of the concern that I have personally, is that, we're getting our funding's under siege a little bit. And I understand you've kept the per capita flat, but there comes a point when, again, the salaries are greater than what we can pay our own folks, and and yet we're still paying at that same percentage, whether we're getting the necessarily percentage of inspections that go along with it. Or is there a duplication of services that we need, like for a town, and when you look at, we provide some of that service already with our social services. What do other towns in our district, what's their social service departments compared? Are we, in theory, paying for some of their services because they don't have the robust social services that we have, for example? Because it seems like there's some duplication of services in my mind.
So if you would have to be more specific for me.
Like the opioid, we have a full, we're trying to do opioid prevention, all the different programs that our social services helps with. So again, you get a small grant with that. So it's along those lines. I mean, the flu shot thing, there's a lot of different ways flu shot can be provided now. So, I mean, those sort of things that, I guess I see duplication of service, I guess is the question. That's just my statement. You don't have to respond to it. Joey.
One thing I'd like to see is, like Dave said, we have a lot of restaurants. So I would like to see how many percentage of the restaurants you look at in Enfield compared to the ones you do in East Windsor, compared to the ones you do in Willimantic, just to see that we're all getting about the percentage. I mean, I know some towns don't have as many restaurants, but in the end, if there's 10 restaurants in ours and 2, and it'll come out to a percentage. So I'd like to see what the percentage is in each town of the inspections for restaurants, and just to make sure that our eating public is getting the proper amount of inspections for our dollar.
So Patrice, sorry, if you want to in conclusion, and if you wouldn't mind concluding, sorry. I know you've probably got more to go, but if you wouldn't mind.
No, I just want to see, I'll look really quick. Well, one thing that you mentioned is we don't do housing inspections in all of our towns, but we do those in Enfield.
What about nail salons?
We do those in all of our towns.
Okay. Because I know Enfield has certainly a high percentage of nail salons.
Yes, there's nail salons everywhere
I'm just,
in the universe.
just saying, I'm not making any comments, just, sorry.
There was one, okay, so I'm not sure I agree exactly about duplication in services, but I see it from a different perspective than you,
Right,
and I respect your opinion.
Because if you're if you're the health district, right, and you're controlling the North Central, you mentioned grants. So here's what I would. So maybe this is just my own view of what I think hopefully you should be doing. There's a ton of private sector money out there for healthy communities, healthy counties. All the private sectors are out there. Yet, what's the coordination between our town and all the other towns through your department, again, to be able to go get those grants? Real money. I'm talking millions of dollars.
Right.
I'm not saying 10,000 is a lot. I'm saying millions of dollars that's out there. That's what I personally would expect coming from the health district to help coordinate that with all the member towns.
Right.
And maybe you're doing it, and I apologize if you are, but I don't see it.
Well, you know what? I couldn't agree more with what you're saying. We have a health advisory council we've formed now, and there's a lot more synergy bringing people together from different towns. We also have an opioid advisory group, and the discussion there is really, really robust because some of the people, I mean, Enfield has a bigger coalition, but some of the other towns aren't talking with each other. And one of the things I learned at a conference I went to is quite often is exactly what you're saying. It's sometimes the role of public health is to be the convener of others. I will tell you, we are just at the beginning, and I'll end with this because I know really I could go on for hours. These are the groups or agencies in Enfield that before I was on board we were not engaged with, but we are now engaged with. Okay, we are just at the beginning. The community health programming has been neglected for a significant amount of time, and it takes time to build those relationships. But these are all the new groups just in Enfield that we're now engaging with. In addition, groups that we were engaging with because of regulatory issues before, police, the police department for one, now we're engaging with them on the opioid issue. Social services, we would work with them if somebody had to be relocated. Now we're working with them, kind of proactively. Your social services person is on our health advisory council. And so it really is no intention to duplicate, but just two quick things. To say that public health wouldn't have a role in the opioid crisis, it's just not the case anymore. So we don't have the option to sit back and not be involved. And as far as giving flu shots, part of the reason that was started on was because we could generate a legitimate revenue stream for the health district, but two other pieces to that are so critical. It helps us maintain our capacity. If we have to roll out vaccinations to the community in the event of a public health emergency, we need to be kind of practicing that all along. Otherwise, we're not going to be able to do it efficiently. The third part of giving flu vaccines or any program like that we embark on is that it brings us more closely face to face with our constituents, and we talk to them and we interact with them and we engage with them, and that's how we start to get a sense that we add to all of the other data we have about what are the needs, what are we not hearing about, what are the new issues that are coming, where are the gaps that we might need to fill. So something like that serves a multitude of purposes. And so I'll just give you, that was my 2 cents on it. And I'm sorry I took so much time.
No problem.
Mr. Mayor, Just in conclusion, we'll put this up on our website tomorrow under the manager's report. And just a couple of things, because some of the questions I've been asked, and to follow up on Councilman Sferrazza, I'd like to also just indicate, because this is more the questions I get from the residents, what is that per capita contribution of Enfield towards your entire budget? In other words, what is the breakdown from the towns? What does Enfield contribute, 30, 40, 50%? I think ties in with that is also what is the total percentage of inspections and your work that then commensurately is done in Enfield, because I'm sure it's higher than the others. And then lastly, you had mentioned about the renovation of the $250,000. So it's my understanding, I know there's been some talk, but it is your intention and commitment that you will be staying in Enfield and that you will be renovating that current public health building.
That's what the board has voted to do.
Okay, do you know when you're going to commence that?
Well, the building committee's in the process of reviewing proposals from people who would be a project manager.
Okay.
So we're in the process of doing that.
All right, if
And
that were-
they don't have a set time frame.
And if that were to change, you would inform us.
Absolutely.
Thank you, Patrice.
Okay. Thank you very much. I have more stuff, so I'll send it out.
Thank you very much for taking the time to put it together, and thank you for
course.
coming. We appreciate it. Thank you. Okay, now we call the regular meeting, Monday, April 1st to order. Sorry, we are 12 minutes late. Prayer, Councilor Ungary.
Lord, thank you for the hope that spring brings and the renewal that you bring to the world. Our thoughts this time of year turn again to new beginnings and possibilities. Walk with us through every opportunity we face, giving us wisdom in our decision-making. Help us to see the big picture as well as notice the smallest of details, and to do it humbly and always with gratitude. In Jesus' name, amen.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item 3, roll call, please.
Councilor Ungary.
Here.
Councilor Bosco. Councilor Sakala.
Here.
Councilor Crisati.
Here.
Councilor Davis. Councilor Denny. Councilor Kiner. Mayor Ludwig.
Here.
Councilor Muller.
Here.
Councilor Sferrazza.
Here.
Deputy Mayor Suzak.
Here.
We have 7 members present, 4 absent.
Item number 4, fire evacuation. In case of a fire, we have an exit doors in the back of the building. You can either go left or right. Please be orderly. Or we have doors to our left, your right. Please orderly exit the doors. Go through the first doors in a hallway, down the stairs, and out into the parking lot in case of a fire. Item 5, minutes of preceding meetings. Do we have 6 folks? Special meeting, Town Council Board Ed meeting on March 18, 2018. Do I have a motion to approve? By Councilor Muller, second by Deputy Mayor Suzak. Any deletions, corrections? Hearing none, by a show of hands, all those in favor? Opposed? We have 6 in favor, 0 against. I think that's a quorum. Special meeting, March 18, 2018. Do I have a motion to approve? By Councilor Muller, second by Deputy Mayor Suzak. Any deletions, corrections, edits? Hearing none, by a show of hands, all those in favor? Opposed? Abstentions? 6 in favor, 0 against. A regular meeting of March 18, 2018. Do I have a motion to approve? By Councilor Ungary, seconded by Councilor Sferrazza. Any additions, deletions, or corrections? Hearing none, by show of hands, all those in favor? Opposed? Abstentions? We have 8 in favor, 0 against. Item number 6, special guest, Kite Christine Gameau. Welcome. Good evening, welcome. Just your name and title, and you guys have the floor. Thank you. Welcome. How you doing?
Hi, I'm Chris Gameau. I am the coordinator for our early childhood collaborative that we call KITE. And I am Leanne Bolio, and I am the chairperson of the collaborative for KITE. So we just want to thank everyone for having us as a guest tonight. We find that typically we come to see you this time of year and just touch base with you. Thank you for your support, and also let you know a little bit about what is happening with Kite and the work that we're doing. So I think many of you know we have a special Kite meeting coming up on Wednesday. We've invited State Senator Kissel and State Representatives Arnone and Hall to come to our Kite meeting to talk about issues that affect families with young children, and also to talk about some of the pending legislation that has recently come out, again, affecting families with young children. So we hope you can attend. It's Wednesday evening, 5:30. We have a 5:15 start with dinner, and it will be held in the Play Lab at the Stowe Early Learning Center.
Chris, can we please tell those folks to, sorry, Chris, please, I apologize. Yeah, we'll close the door. Sorry, go ahead.
No
Apologize.
worries, no worries. So, would you like to start?
Okay. So it's important to us that we, as Chris said, thank you, and to help you to understand that the support that you give us has allowed us to leverage some very exciting opportunities through private foundations, and we would like to share with you kind of the combination of your support and their support and what we are currently doing with that. We're currently doing our work in 3 major areas. We have our Play campaign again. We are working on issues related to the mental health of young children, and we are also expanding our work through a network that Chris will explain to you, doing work with a multi-generational approach in terms of working with children and young families. And we're going to start with Play. And just a little bit of background for you. I think, as you know, there's been an increasing focus over the past 10 years into research that helps us to know how children best learn, not just academically, but socially and emotionally. As I'm sure you have read, there is overwhelming evidence that children actually need to play in order to grow, learn, and be comfortable and confident in their world. And I'm sure that they have spent a lot of money on that research, and you could have told them that without that research. But there it is, confirming everything that we've known. Over the past 2 years, through a generous grant from the Hartford Foundation, Kite has sponsored a Play campaign to help families, educators in our community engage young children in fun and challenging experiences.
So to continue to talk about our work with the Hartford Foundation for Public Giving, we were given an opportunity through funding to participate in a regional collaborative network. We do that with, there's 5 of us, so there are 4 other towns: West Hartford, Wethersfield, Bloomfield, and Manchester. And this opportunity, through this opportunity, we were given a grant to look at multi-generational programs and to bring that work to back to Enfield. One of the exciting things is that we as Kite, although we focus on children birth through age 8, do understand that children do not operate in a bubble. So I think we have always looked at the family as a whole, but this opportunity has given us the ability to kind of take a more direct and a more intentful look at seeing who our community partners are. So it's given us the opportunity to reach out to area business. We've worked with, reached out to adult education. We've been able to connect with the American Job Center that's held at Asnuntuck, that's housed at Asnuntuck Community College. And we are a great partner with Asnuntuck, and we have been. So this just helps us to do it with a little more intent and to help increase the collaboration that we already do with area partners. So it's an exciting piece of work. I was recently at a video release. The Hartford Foundation, along with Head Start, along with the Office of Early Childhood, created a video centered around coaching. And I was able to be at the video premiere for that. And there was a lot of talk around multi-generational work at that meeting. So I think we're going to see a lot of other opportunity come from this initial kind of dive in here on a local level.
Do you want to talk about Play? That's
Yes. So I think we have a really wonderful play campaign. It's called Enfield Plays On. We partner also with Manchester. They have Manchester Plays On, and again, this is through the Hartford Foundation for Public Giving. But as part of the work that we do here in Enfield, we do have a lot of play events for families, and all of our events are always free. We have the Play Lab at the Stowe Early Learning Center that we have been opening to the community to come in and to check it out and to see what it's all about. We have play ambassadors that have been trained through grant funding that Kite has received. So we recently had a play event at the Play Lab called the Prince and Princess Tea Party, which was very successful. So we are able to offer opportunities for early care and education centers. We recently had kindergarten field trips have started to come out to the Play Lab. So there's a lot of play going on. One of the huge successes that Kite has had, I don't know if you've heard about them, but we have what we call a Playcation kit. We have one in the summer and one in the winter. And what these kits do is they provide materials for families so that over summer vacation they can get a playful idea of the day, and it's opportunities for families to engage and play together as a way to foster learning. So the kits over the summer are a bit larger than those over winter break, but they've really caught on and families love them, and their popularity has grown, so we're getting ready to once again put that kit out for summer.
So I guess one of the things that I just want to make sure that we're talking about is when you talk about that multi-generational approach. So we hand out those kits, and there's all different kinds of materials, little materials in there. And every day there is, or every few days. Is it every day? It's every day. There is all summer long. This is a parent sanity program, and it actually shares with families what are the options for, what can you do today with this kit. So it's keeping children creatively engaged, but it's also helping to model for parents some ideas that they themselves can start to use with their children. So it's again that two generations, the children and the parents. The other area that we focus on is young children's mental health, and I think this area of our work is especially, I guess, gratifying to us because it's in the way that it has brought together Kite, the town of Enfield, and the Enfield Public Schools in a very exciting and just creative partnership. We are truly grateful to Jean Hoy and Don Homer Bouthiette for the vision that they share with us and their spirit of collaboration that they bring to our shared work, especially in this difficult area of urgent need for young children and their families. So we are all seeing everywhere in the country, everywhere in our state, in our town, we are all seeing an increasing need to find ways to help children who are struggling to manage their emotions and their behaviors in a world that is becoming more rapid, more complicated, and more demanding. And stressful. Growing numbers of children face traumas that interrupt their lives in ways that are far-reaching, preventing them from engaging constructively in the normal activities of school, community, and family life. And it is difficult with very young children, as it indeed it is with all children, but especially difficult with young children who don't have the language, the sophisticated words to figure out exactly how to express what's going through their minds, and then to be able to take that and act appropriately on those kinds of things. So these are, Chris will share with you some of the collaborative things we're doing in Enfield.
So one of the exciting things that we do also get one of the benefits through grant funding, in particular the Fund for Greater Hartford has granted us funding for professional development on social emotional learning. So we were able to, for the first time, partner with the Enfield Public Schools in February and provide, Peg Oliveira came to provide professional development, which we've heard wonderful feedback from on, she talks about trauma in the classroom and social emotional learning, and this is something that we look forward to continuing. It's the Fund for Greater Hartford. It is their passion right now. There's other funding opportunities that we'll be searching out in this area as well, because, as Leanne said, there is such a need. In June last year, we were invited by the Office of Early Childhood to participate in a 2-day social emotional learning institute. So we were able to partner with different sectors of the town. The Family Resource Center, the public schools, and we attended a 2-day training, and were given a charge to bring that work back to our community and to continue and expand on it, which I feel that we've done a great job. We have a social emotional learning committee that's doing that work as well, and we have members of the KITE Leadership Work Group that also participate in the trauma-informed schools. So I feel that that's an area that will continue to grow, and that KITE is very fortunate to have received funding from the private sector to bring this work to Enfield.
So we're okay. Now, again, just thank you so much for not just for all of your support, most especially your presence. You come to our events, you come to our meetings, and for a collaborative that brings together so many different sectors of the community, it means a great deal to all of us. So we really do appreciate the time and the interest that you have showed for us and for young children and families.
Thank you both. Any questions? Councilor Denny.
I just want to thank you for coming in, all the hard work you people do, and we all appreciate it.
Thanks. Thank you.
Just a question. So my intellectual question. So are we tracking now? So you mentioned the trauma and the early childhood mental health difference than when we were kids. So I don't want to go back to but are we tracking some of this intervention or programs and seeing what the outcomes are going to? Are we already doing that? So when one of these children make it to 12th grade, or are we? So meaning if they're not getting it, so if they're not coming to KITE, or they're maybe they're just in the community, they're not coming to one of these programs. Is there actual anecdotal data that says this is really having an impact for these kind of children as they get? Are they graduating more? Those like kind of the output of all the sort of the programs that we're sort of investing with the young kids.
So there's two parts to that question. So KITE does, and KITE has looked at data and started to kind of collect data and see what impact we have as far as bringing professional development opportunities to providers, and even training opportunities to parents. So there's always a follow-up, and there's always questions asked. So we are really focused on kind of collecting that data. I think a lot of the data that you might be talking to will be collected on the school level as they track the individual progress of these children.
Kind of a friendly handoff type thing?
Throughout the school, they'll be able to tell with their scores. And I do know that, some of the programs that it's kind of changing the lens. So it's not so much bringing a program to the schools or to the early care and education centers. And I think over time that they will see that. But on a more immediate level, we have begun to track kind of the progress on how effective the work that we have brought to Enfield, what people think of that. So we have started that. So
it's really just kind of the coordination, right? So we're talking about, so I know it's sensitive when you talk about so much child, but if we're identifying some of these children early, are we communicating, or again, a friendly handoff with the schools or with the daycare if they're going to a daycare? So again, we can intervene and provide the proper programs at the elementary school level, so they don't maybe get mislabeled or get labeled incorrectly. So all that pre-work is for the reason now we're setting up that child for success, as opposed to being, this child may be disrupted in class or XYZ. You know what I mean?
Yes,
So we actually
we do.
catch it, catch it early so it doesn't become issue later.
One of the things that several of our providers complete is kind of a almost like a school readiness survey. And those children that have been, for example, at ECDC or some of the other providers, they provide, so it really looks at the end of the year with them, what are the areas of strength, what are the areas of challenge for those children, and it does point to some of the social and emotional issues. It also actually points to some of the physical issues too that they may have, cognitive
Are
and
you
physical.
allowed to share that with the school system, or is there federal laws that prevent you from sharing?
So it goes with parents' permission from the providers to the kindergarten teacher. So that it is, and again, it certainly is not going to go for those children whose parents or families are reluctant to give that permission, and we do respect that. But at least we're beginning to look at the transfer of information in a way that's safe for the families and valuable to the teachers in the public schools. And then obviously when they go from one grade to another, Mike, then obviously that information
The
is
only reason I
shared.
ask, I mean, right, they have to disclose they have a peanut allergy, right, for example. But we're not going to disclose that if, hey, maybe a certain type of teacher would be great for that child at that age. We're not disclosing that, so then there's potential where all the good work that was just done could, you know what I mean? So see where I'm going?
So I think one of the things that KITE does really well, and kind of to the point that Leanne said, really what we try to do is help kind of make the connection and coordinate and collaborate. So for example, the Ages and Stages, the developmental screening tool. There was, our work with the pediatricians, and we're continuing that work, and it's. But when we first started, and we connected with the Enfield pediatricians, it was around one of the areas was developmental screens. So different folks were screening. But what we tried to do is bring them all together and kind of open the avenue of communication. So we said, okay, who is screening? What are the pediatricians, and how do we make that connection? Just so that, KITE is not the screener,
Right.
but how do we help get the information communicated from one to the other that will benefit the child? So that's kind of the work we do, help to make that connection.
Right.
So.
And we really do need to make sure that we help organizations and
Right.
and districts to start looking at how do we know.
Right.
And that's certainly something that we will continue to include in our discussions with those people that will actually do the work. Yes.
Councilor Crissati, thank you.
Well, I'd like to thank you for your time and effort into this program. I think this is one of the most important programs because I feel as though these issues that are affecting families and young children, I mean, that's the key. If you get to them at a younger stage and with your collaboration and all the different types of training programs that you have and the support that's given in this particular program is very beneficial. We speak highly of this program and keep up your great work.
Thanks,
Thank
Bob.
you.
Yeah.
Anyone else?
And I love that plate campaign.
Yeah.
Anything else in closing? I mean, if you guys,
I just want to mention, I do have our last community report that we put together. I just brought a copy for everyone, so you could take a glance at it.
perfect.
Thank you very much for your time.
Thank you so much.
Thank you very much for coming. Thank you. Moving on to item 7, public communications. At this time, first round will be 5 minutes. We ask folks to please refrain from personality. Anyone like to speak before the council at this time? Anyone likes Mr. Ballard?
have a little trouble finding my way.
Here, come on.
Yep.
There you go.
When you lose your...
Come on over there.
Oh,
Yeah, let me move this chair. It's on the left here.
I got you. Just turn around.
yeah, you don't have to hold me.
You know what I'm saying? No, I'm just trying to aim you.
Oh, well,
He was gonna knock you over, Bill. You better be careful.
Down now, Bill.
over next.
He was about ready to hit you with that chair.
You can sit down right behind you, Bill. There you go.
see, I'm used to feeling...
There.
I'm
I'll
feeling
roll
my
you
way
in
to
now.
the chair.
There you go.
He almost pulled an April Fool's trick
Here's a tip.
on you.
Here's a tip.
There you go. There you go.
Okay, are we on?
You already used your 5 minutes, Bill. Sorry.
Well,
No, go ahead, sir.
I'm going to call the cops and arrest you. Ladies and gentlemen of the council, good evening. My name is William Ballard. I live at 321 Abbey Road, Enfield, Connecticut. I've been a resident 52 years this month. And as you can see, I'm gaining in age. My doctor says I'm aging gracefully, but I doubt that. Anyway, I'm here tonight to say a few things because I can't get out here anymore. And first of all, I'd like to compliment the mayor on his leadership of the council and how inclusive he is and how transparent he is. And I'd also like to congratulate the town manager for his appointment. I've known you for many years. You've been a dedicated servant to the town. And I really am impressed with the openness you have presented to the council and to the public. I've gone through all but one town manager in my 50 years here, and you are the most open person I've ever seen, and the town is very, very lucky for you. Now, for the bad news, no. Kidding, of course. I want to thank the council for coming up with a resolution against the tolls. It's going too far. The state government has not learned how to cut spending. And I compliment the town for the fact that when the governor gave us this increase this past year, after the budget, our budget was passed, the town came up and didn't pass that increase on to us. I mean, federal, state, and local taxes are killing us. And we're all working families. I don't care in what position in life you have or how much you make or whatnot. We've all earned those positions by working for it. And it seems most of it is slipping away. And thank you for that. I want to thank Councilman Bosco for pointing out that the opposition was given plenty of time to come before you and get together with you to include themselves in that resolution. And the resolution, the purpose was to inform the government and the state that we're not happy. And you have to let them know beforehand before they bring up a decision and make a decision. You don't prepare for a hurricane the day before, you know, and that was a hurricane. It is a hurricane. It's killing us. I would like to congratulate Councilman Kiner and Councilman Srazza for their appointments, and also Mr. Cruzati. I didn't have a chance to get here to wish you luck. I know your cousin very well, and I was very, very good friends with him. I've known Mr. Kiner for 50 years, or better, or less. And I was his first opponent when he ran for the State House back in 1976. And nice to see you, Will and Carl and I appreciate your work. Okay. Okay, covered that. I covered that. I had a couple of criticisms. One is when you're reading off the appointments to the council, to their different commissions. You take it off the table, and you go ahead and vote on it. Excuse me. You go ahead and vote on it, but you don't mention the name beforehand. You only mention their name when they're being voted on. And when you're at home, sometimes the communication isn't that good. And of course, sometimes we elderly people are a little hard of hearing, and I'm a little blind, but that doesn't answer into the fact. And also, when the people come before you, they don't mention their names loud enough. They mumble, and you don't know who they are. So you don't have an opportunity right away, if you want to call them and thank them for what they said, you can't do it. And I think there's a little issues that are important. And some of you council people do not have the microphone closer to you. And some of you come out loud and clear, and some of you, when you finish speaking, you push the microphone back too far.
30 seconds.
Just a little housekeeping. Let's see. Oh, there was one other one, and I didn't write it down. I thought of it on the way here. I forgot it. But anyway, I came here tonight because I really appreciate the information this council gives to us, and I really appreciate it coming into our homes, because I sorely miss coming to your meetings. Tonight I'm not going to stay long. I have an eye appointment tomorrow, and I have another surgery coming up, but we're getting along, and we love Enfield, and we love your dedication. Thank you very much.
Thank you, sir.
Do I get a chance to call you from home and get on the...
You sure can.
Anyway, I'm not computer-oriented too well. Thank you very much, and God bless.
Thank you, Bill.
Yeah, just stand right up and then use me as escort.
Thank you, Steve.
Thank you.
Anyone else like to speak for the council? Bob. Thanks, Steve.
You're welcome. Yeah, do you want to go or do you want to stay?
I'll sit in the right chair this time.
Welcome, sir. Name and address.
I don't know where I live.
Better be Enfield.
I've been around a while. Bob T. Katz, 815 Woodgate Circle. My question is, when are we going to upgrade our TV system? Because there's a lot of defects in it. Long Meadow's finally in HD. They have 4 channels, though, and I think that's a little overdone, but and they're half the size of Enfield. But there is a problem over the library, and that's the copying machine. And I did talk, there's a big problem. They're 15 years old. You can't buy parts for it. It needs drums. He doesn't know if he can find any somewhere. But he did tell me, he says, I don't know why the library doesn't change over. You don't need 2 machines. We can put a machine, this is what he told me, I don't know if it's true, but he said we can put a brand new machine, it'll have the fax and everything. And he says all you have to do is charge 15 cents a copy, and it's money, there's no money that's going to be cost the town. It's money neutral. So, and I asked the library about it, but they don't know. They said their budget is tight, but he said it's not going to cost the town anything, and it needs an upgrade in the library because it's the highly used machines, and I don't know why we buy cruisers and we buy public works equipment when it's needed, but other things we don't upgrade when it's needed. So we have to look at everything, and if it's cost neutral, we should do it. Thank you.
Thank you, Bob. Appreciate it. Anyone else like to speak for the council at this time? Ma'am? Welcome.
My name is Gina Gelter, and I live on Putnam Lane, Enfield, Connecticut.
Is the light on, ma'am?
Yes.
Okay, go ahead. Go ahead, sorry.
Okay. I have a complaint about the big trucks going down North Road, and they're not supposed to. There are signs up there. I believe they should have bigger signs saying that, you know, they disregard the signs completely. And one of my girlfriends nearly lost her life there with one of those trucks. So something has to be done, because some innocent person is going to end up with their lives taken because of those big trucks. So is there something that's going to be done about it before someone does lose their life, or what?
I can't go back and forth. We can have someone look at it, you know, through when the manager speaks.
Okay.
Okay.
So that's about, I have the note here from my girlfriend saying what happened. I can leave it with you.
And you said North Road?
Yes, North Road.
Yep.
So did you want me to leave the note here?
You could leave it with the clerk, yes.
Okay.
Thank you very much. You still have time, ma'am? I don't know if there's anything else you'd like to speak of? Anything else? You still have time? I don't know if, you okay? Okay. Well, hold on, Charlie. Ma'am, you're all set?
Yes.
Okay.
Thank you.
Go ahead, Charlie.
Charles Woods, 11 Westerly Drive. Been a long time since I saw you folks. Been staying away because I never was happy with some of the answers I got off from here. Hoping maybe there's a little bit of a change with some of the new people. To piggyback off her statements, we have a couple of spots in town that are extremely dangerous. One is coming in and out of the big wide parking lot. When you come in from either way, there's, if you're going north, you're not supposed to make a left, and when you come out of the parking lot, you're not supposed to make a left there either. I saw a police officer stop and let a person violate that law. Luckily, I got to talk to the deputy chief at that time. He was very nice about it, said he would talk to the officer. I have not seen an officer help somebody break the law again since then. Another spot is right by Friendly's. There's no left turn. If you're coming toward town, there's no left turn there. Now, first of all, the pavement is painted wrong. It's not cross-hatched. So, especially people from Mass, they think they can make a left turn, but you can't. Now, I've seen some of our new patrols are sitting out there, very good, catching a lot of speeders and that. But those areas that are identified as high areas of for a chance for an accident should be watched. People coming out of the CVS right there across the street from Stop and Shop, the way those lines are painted, take a look. You have to cross a solid line to come out of there. You shouldn't be doing that. So somewhere in the engineering section, that should never have been approved. So we do have a number of things to look at, and hopefully we will get that done. One of the other things that kind of cued me in, you have a rule not to name somebody for doing something wrong, but are you only talking about on the council or ex-councilman? That's a question. Because I know that selection for some of the committees, I've seen in the past, when a council member didn't get some special privilege, they went against the person that was running for that position. And the rest of the council went right along with them. So you people are making some mistakes too. So I'm not naming the name, but that person is not on the council anymore. A lot of the appointments that we're making in town, you know, I hear a lot of people talking, and they come running to me because they think I might know something, but I don't know necessarily unless I come up here and talk to you people. But you're not going to get that feedback if you can, you know, if you don't pay attention to what's being said to you. So hopefully you new members will pay attention. A number of us have something to say to you people about what we're hearing on town. And that's who you should be listening to, is the people in town, the people that do the votes. You know, I heard the briefings that we had here tonight. And I said, one thing I never heard, like, how many people does this affect? If you start a program, how many people are going to benefit? How many people are eligible? How many people will it affect? How many people will it not affect? And how many people have to pay? Because the other part, the big part of the job that you people have is to keep our taxes down. And if you're not watching bad management programs in town, then you're doing us a disservice. And one of the biggest ones is, I read in the Journal Enquirer, hey, here's Windsor Locks cutting back on their teachers. Oh, you mean to say they're not going to take a loss from the state because they're cutting back on their education? If they're not, why aren't we doing that? Because that's one of our biggest costs is education. So we are, you know, everybody keeps saying, well, this is what the norm is around the whole area. You're not looking at the cuts. You got to look at the cuts. I'll tell you right now, if you people were federal, you would have had an investigator in here already looking at all the management programs that are going on, the practices that are going on, and to see where there's waste being done. And maybe we need that kind of an inspection in town. Thank you.
Thank you. Anyone else like to speak for the council? For the second time? Hearing none, I declare public communications closed. Moving on to item number 8, councilor communications. Councilor Sferrazza.
Just have a couple of things. First off, I had the privilege this past week, along with a lot of our council folks here, to go to the swearing in for our new deputy chief, Fred Hall. And I can tell you firsthand, having worked with Fred, knowing his character and his integrity, tremendous promotion. It's going to benefit the community and the police department. I want to congratulate Fred. Number 2, during Fred's promotional ceremony, as happened one other time, it didn't get cut short, but we had a very serious incident occurred on Alden Avenue at that time. Everybody knows about that. We had a person got shot. I'd like to compliment the police department, not just for their rapid response, but what I want the community to know is that before we knew where the shooter was, not only were the Enfield police resources on scene, but we had cooperation with all kinds of surrounding towns, both armored vehicles and personnel. And that wasn't just because we're lucky. The police department for years has worked to help our sister towns and neighboring towns. And the fact that when these tragedies occur, we can keep loss of life at a minimum and keep us safe, it should be reassuring that we have that type of law enforcement. And I know a lot of people are thinking, well, naturally, what am I supposed to say? But I mean that as a citizen. I just think they did a tremendous job. And my final thing is I'd like to direct this to the town attorney through you, Mr. Mayor. I was very sad to read in the paper that our governor has made the legalization of marijuana a priority in this administration. It looks like it's already come out of committee. It's looking more and more like a reality, and there's not much that we're going to do about that piece of it. I'm not going to give a big speech today why I'm against it. I will when the right time. What I'm concerned about is I look to see just to our north when Massachusetts passed it. There's 300, I think, and 85 communities up there. 185 passed ordinances, either temporary or permanently, banning the sale of marijuana in their communities. The answer to this is probably going to lie in how the legislation is crafted. But clearly, if there's an opportunity in that legislation where each town, I'm speaking for myself, has the ability to bar or ban the sale of, we're not going to be able to ban the possession once it's legal. I, for one, do not want to see marijuana sold in the town of Enfield, and I'd like us to kind of track that legislation. When the words come out, the legislation comes out, we'll be proactive and not reacting to it to see if there's a consensus here among the community to ban that. So that's just in the next few months.
Thank you.
Carl?
Yeah, I'm done.
Councilman Bosco, Councilman Crisati, then Deputy Mayor Sousa.
Through the mayor to the town manager. I think I said it before, but I may not have. There's a pair of shoes in the intersection of Phoenix and Post Road hanging in the wires, and it just looks terrible. You know, it looks really ghetto. And
Come on, Joey, are they yours? Come on. Come on.
they're sneakers, and I very rarely wear them. So I'd like to see if we can get them things cut down. And seeing as the construction season's starting again, I'd like to see if we can maybe do something with the curb at that intersection. If you look at it, you can see it's very well hit. It's sort of sixed out in the road. They sort of need to curve it back a little bit so the trucks don't hit it with their right rear tire. And one other thing is I remember during last budget season, we actually had a pretty good discussion on copiers and supplies. So I thought that once the supplies were gone and the copiers, we were going to get new copiers. So if you can look into that for the library, because we can't be fixing old things. It just isn't worth it anymore. So that should do me.
Councilor Crisati.
I have a few announcements, a few events that I also attended in regards to, congratulate to Officer Captain Fred Hall on his accomplishment, his promotion. Also, I just want to give a little heads up and some congratulatory words to the Allied Rehabilitation Sports Programs. Over the last weekend, they had the 4th annual Al Burnell Basketball Invitational, which was held at the Town Annex, and this invitational serves as an alternative to tournament to Special Olympics basketball program. The event had approximately 100 athletes from the surrounding towns of West Hartford, Hartford, South Windsor, Somers, Windsor Locks, and Enfield. And a special thanks to Allied Rehabilitation for hosting this event. It was a nice event. Also, the Enfield Stars are competed in the Eastern Regional swim meet 2 weeks ago, and congratulations to all the team members for their efforts and their coaches who put in a lot of time and effort. They're training now for time trials in May and state finals, which will be held in June. A few weeks ago, just to give a little update on some things that are happening with the Commission on Aging. Senior home repair, I know that we've mentioned this before, are taking a request. Their program and their work is going to be starting in on April 2nd. Call the Social Service Department to make any types of requests. The Isolated Senior Focus Group is holding training sessions on their programs focusing on senior-to-senior interaction between the Faith Baptist Church and the Food Shelf. The Senior Living TV program, which is hosted by Martha McLeod, currently airing on cable TV. And just in a couple of weeks coming up, the Senior Symposium, which is going to be held at Asnunktuk Community College April 30th from 9 to 12, and that seminar is going to focus on dementia and Alzheimer's. And getting back to complimenting the police department on their on their excellent work that they did. At the Enfield Library on April 22nd, they're going to have a program sponsored with the Enfield Police, and they're going to have an active aggressor program. And I think that is, you know, something that we had talked about. And not only would I like to see that, you know, now here we are doing it for the seniors, but I also think that we should start talking about, you know, this training and for the safety in our schools, because this is actuality. You know, nothing's going to happen like this around in our town, and here we are. This is a major thing that did happen, a live shooting, you know, right around the corner here. So I think that's something that, you know, through the mayor to the town manager, I think that's something that maybe we could, you know, address in terms of the school system and schools for training. JFK completed or competed in their first unified basketball tournament. Special thanks to Coach Masseri and Ms. Crisati for starting this program at the middle school. They have this program at the high school, but the program now has filtered down into the middle school. A lot of people are involved. I wanted to mention at the last meeting that I didn't, that JFK girls basketball team won their first ever crawl basketball championship, and that's the Connecticut River Athletic League. And they took a last place team, and this particular, they got a new coach this year, and she did a fantastic job, and they ended up winning the large school championship. And I want to just congratulate Coach Sears for her efforts. And I have to give a plug for JFK. There's been a lot of activities and a lot of improved communication over there, especially since they named that new principal over there, and they're doing a nice job over there. Through the town, through the mayor to the town manager, do you think we could have an update from the police and EMS on the number of successful opioid and Narcan saves, and the number, you know, who are receiving help? I know that we have this program in town, and I'd like to see that. And I know that that Carl went to the state legislature on this, and I think that I'd like to see what our numbers are now in regard to this, and you know, and how many narcotics arrests have been made over the last 9 months since Chief has been in. And I know that there's a concentrated effort on that. We haven't talked about opioids in a while. I wanted to bring that back because I think that's something that we can't lose track of in town. All right, so, and then the other thing I just want to state is special thanks to the DPW and to the engineering department on their response to a couple of constituents that are in my district about the Southwest Road reconstruction project in Thompsonville. Immediate responses on some of their concerns, and you know, they were notified by mail of the project. They threw some concerns out to me. We forwarded the information to them, and their response was awesome. The lady, Ms. Trapanese, that I did talk to, her concern with her mother, she was very happy with the responses that she got and the communication. So very happy about that. And also, the last thing that I'm going to say, and I'm going to be quiet for a while, was over on Bridge Lane, talking to some of the residents over there. They're going to be happy with the guardrail, the work that's going to be done on the guardrail and the painting of that. So a lot of positive things that are being happening that are out there, but I just had to get caught up on a few things. All right, thank you.
Deputy Mayor Suzak.
I guess the first comment is on the copier at the library. I know the Board of Ed went to leasing. I guess we don't lease at the town hall on our copiers. We're on an ownership system and maintenance. So I guess that's a question that maybe we could answer. I guess on the roads, what input do we have on traffic on Hazard Avenue and Elm Street, which are state roads. What kind, I mean, most of Mr. Wood's concerns were, you know, state road, I guess, flow of traffic, for lack of a better term. And on North Street, it's constantly been requested that that be no through trucks. And Joey's going to tell me I can't limit where the trucks go. But we have put the sign up on the entrance because that is a safety concern. We didn't create it, but those trucks cannot make that turn. But, and I don't know, you know, I have a lot of discussions and they tell me, you know, if a truck has a destination, it's not a through truck. So they pay taxes and they have rights, and unfortunately we have rights, and I think it's a constant battle between, and for one thing, I think that whether they have a right to be on the road or not, we all have a right that they obey the speed limit. And if the speed limit on something like North Street is 25 miles an hour, if that gets enforced, then maybe you would have truck traffic going in different routes that allow 45 mile an hour. And I also attended the Spring Splash, which I believe was a huge success. They eliminated the novice this year, so I did not go into the water. Thank you very much. Didn't want to get pulled out. So I'd like to make a motion to suspend the rules and move items E, F, H, I, J, K, L, and M to miscellaneous and proceed to vote.
Motion to suspend the rules by Deputy Mayor Suzak. Seconded by Councilor Denny. Any discussion or concerns on the motion? Hearing none, by show of hands, all those in favor? Opposed, abstention? We have 9 in favor, 0 against. All set?
I'm all set.
Councilor Muller, then Councilor Sakala.
I have one announcement. Toast of the Town, hosted by ERFC, is April 26, 2019 at 6:30 p.m. at the Old Country Banquet in Delhi. The tickets are $30. Tickets are available on erfcinc.org or by calling 860-253-9935. There's beer, spirits, wine tasting, and live entertainment band. Thank you.
Councilor Sakala.
Thank you. Through the mayor to the town manager, I know that we discussed this, but I've been fielding a lot of phone calls, text messages, and emails regarding the field usage fee that we passed last meeting. And I know that when we passed that policy, it was with the intention and really the agreement that those fees were going to change. The policy would stay in place, but the fees were going to change. So we'd really like to have that on the agenda for the next meeting, since it's not on tonight's meeting. So we really need to get that done. So
You'll have an update. DP, I don't know, do you got? Yes.
Yeah.
If you don't mind.
I know that there's a meeting coming up. I just want to make it known that we need to make it. It needs to be on the agenda ASAP.
So you might, I'll defer to Councilor Denny if that's okay. Go ahead, Ed.
Tuesday will be the Public Works meeting at 2 o'clock in the afternoon, and we'll discuss that, and it'll be brought up to the council meeting on the 15th. The 9th. April 9th, Tuesday the 9th, yes.
You okay? Ed, since you're good? Councilor Angara.
Okay. I also wanted to congratulate Fred Hall on his recent promotion. I also wanted to announce that through the Enfield Together Coalition and Youth Services, they're going to give a presentation on May 7th at 10 a.m. in the morning with a social hour before with Dr. Michael Ferris, and he's going to give a presentation to all the church leaders as a preview, and the council's invited if they'd like to come. And then if the church leaders all approve, they're going to invite the young people of their congregation to come, and we're going to have a big rally. So that's going to be May 7th.
Anyone else? Chris, the only thing in closing, I just want to publicly thank everyone from Town Hall and from other town buildings and services that showed up and to support again, the promotion of Deputy Chief Hall. It's great to see, our staff supporting other staff, and again, there was a good feel, which is exactly what we're trying to create. So kudos to you and your staff. Moving on to item number 9, Town Manager Report and Communications.
Yes, thank you for that, Mr. Mayor. That was a completely heartfelt on the part of our employees. They're always welcome for swearing-ins as the council is, and it was a very good representation because after all of the years he's been with the police department, he's made a lot of friendships and garnered a lot of respect in the town, and that's both employees and our residents. I'll try to go through the different issues that were raised first because I already had it down as an update on the fields. We did a comprehensive review of the fields over the last few months, realized that there was a deficit because in the policy that had been adopted, there was no rate structure for the fields. So we put that together. We tried to do it in a timely fashion because obviously people are trying to reserve the fields for the use for this spring, summer, and fall. We relied on Mark Garr, his insight, and his decades of experience to guide us. As I said when we passed it, just like a blight review or anything else, have patience because we're going to get feedback from it, and then it can always be adjusted. That's why it was done in a resolution form, and it isn't an ordinance, so we're able to accommodate it. And the 3 areas we're looking at that have been raised, so everybody knows, rates that we will charge, if any, for practices, teams that are exempt or want to be exempt, and 3, then the actual usage fees for in-town teams, perhaps some other teams that are quasi-local that aren't currently exempted but aren't purely for profit, and those rates will be looked at as well. So we'll do it at the Public Works Subcommittee, and then hopefully we'll have a recommendation as we did last time for the full council to consider. I would just like to say that you have to understand this is only being done because we have a high demand for the fields. They're used. There's a cost associated to keeping those fields up and keeping them or trying to keep them in condition. They're more heavily used in area towns because we never had a rate structure. So by default, a lot of outside teams, including towns, other municipalities, were using our fields at no cost, and that's not fair to the Enfield taxpayers. There was a proposal this year, in fact, to replace the high school field, a synthetic field, and there are new requirements. It's going to be over $500,000, $500,000. And I just don't think that our residents should be subsidizing for-profit, out-of-town people to come in and use those fields for nothing and then expect our taxpayers to subsidize private businesses. So I want to be clear about that. That's really why we looked at the rate structure. There's always room for improvement and adjustment, and I'll leave it to the council's discretion to do that. But much like the upgrade at the water pollution control, general tax dollars and bonding will pay for the upgrade. But the council sought to be equitable, and the usage of water is what we then are going to run it on to say, okay, now we're going to be equitable, and those who use it, those who use more water will pay more, those who use less will pay less, much like the field. Our taxpayers are going to have to pay that $500,000, but those who use it, it's only appropriate if you're from out of town or you're making a profit that you should pay a usage fee. We shouldn't expect our residents to have to bear that burden as well. So that was the thinking that went behind it. And I did ask you to have patience, and I thank you for your patience for those of you who are fielding the calls, and we'll look at it and see what accommodations should be made, if any. In regard to roads and regulation thereof, you're right, Deputy Mayor Suzak. State roads were preempted by state law. That doesn't mean that we shouldn't be looking at enforcement or looking at proper signage or painting to make sure it's done in accordance with the state law and make these areas that Mr. Woods in particular and on North Street, the other resident mentioned, are safe. And as always, enforcement is important, and we'll look to make sure, because you're absolutely right, perhaps there's an area that we have to allow trucks or we have to allow traffic, but that doesn't mean we shouldn't enforce the speed limit and other motor vehicle laws to make sure all of our roads are safe for our residents. In regard to copiers, we have had a comprehensive policy over the last few years. It's also being implemented this year. The copier at the library is included for a color copier that will provide that people can pay the cost of it to offset the use. We can't put that in the leasing package because the leasing company doesn't do those types, so that'll be separate, but it's in the budget, and unless you cut it, then I have included it. Likewise, for the viewers at home, I know we had technical difficulties today. I'm told by our people in our Enfield TV that that was on the Cox cable end, not our equipment or our people, and they did talk to them and communicated it, and they corrected it. We do also have in the budget for the HD upgrade and improvements that we promised, and that also is in the budget for the next year. In regard to the whole issue of police officers and active shooter, we take that seriously. We've had a robust program in the police department and with schools over many, many years to ensure the safety of people throughout the town. I won't get into too much detail, but we, as continuing with our training of our police officers. All of our police officers will be going through, and the council approved it because it will require overtime. All of them, all personnel, administrative, and all of our officers, right up to the chief, will be undergoing active shooter training. It will be an entire 8-day classroom and in the field. And it's important to note that, as we see around the country, these incidents are just not limited to schools. It can be municipal buildings. It can be private companies or even malls or hotels. So this training is inclusive of all of that. And as you know, we have a newly reconstituted Public Safety and School Safety Committee, which meets quarterly. We've met, and these issues are being discussed. And I would just let people know at home, the school department does employ a former Enfield police officer as its safety director, Gary Harrison. He's very capable. He's cognizant, and he's always looking at all of these issues of structural security training, and these issues are being addressed. We just can't talk about them too much publicly, but they are very much in the forefront of our minds. In regard to police and EMS, we certainly do track Narcan use. We can get you those numbers. The chief also, as a result of the program that he inducted about giving people an option to go to a hospital instead of being arrested under certain conditions, he has the statistics. It has been climbing. I still think it's in the single digits of individuals who have availed themselves, but it is increasing and it is available, and hopefully that will grow. I would just state that we do, as the chief said, we have a very good relationship with our local and area partners in law enforcement, our state partners, and our federal partners. We will be hosting at the second meeting in May, I believe it's May 20th, we'll be having a special 6 to 7 o'clock, and we'll try to promote it as best we can. There is a new special agent in charge of the Connecticut FBI. The chief and I have met with him a couple of times. We extended an invitation for him to come because they offer a lot of programs now that aren't just, it used to be if the FBI had to be a kidnapping, had to be a bank robbery. They've gone far beyond that in cybersecurity, in cell phones, investigating drug crimes, firearms crimes, and he has offered to come. We have accepted that invitation. He's also going to have representatives from the U.S. Attorney's Office, and those are prosecutors in charge of prosecuting federal crimes. They work in conjunction with our local state's attorney, who is also going to come. They offer resources to them, helping them in prosecutions. And in point of fact, recently, and I've sent them to the council, it used to be that if it was a drug crime or somebody had died as a result of an overdose, it was a local crime. Well, the federal government is now pursuing those, and direct prosecutions and long periods of incarceration have been imposed for arrests made by Enfield police in drug cases that were referred to the U.S. attorney, and I've provided those to you. Maybe we'll make them more public in the future. So there is a very dynamic interchange going on of local, state, and federal people in this town. We're very thankful for their help and participation, and that will be a very informative and interesting presentation because those are the highest federal law enforcement officers in the state of Connecticut that are going to come here, talk to the council, and people at home will be able to hear all of the different things. And it used to be back in the day, and the chief can attest, the federal government, they were an island unto themselves. The state, people were territorial. They didn't want to share information. They didn't deign to come and help a town. That's all changed. It's a new world, and they recognize that we all have to be rowing in the same direction given the threats that we face at home and from abroad. So I think it's a positive relationship we have, and I think you'll find it of interest on May 20th. I think that covers all of the matters that were raised and what I had, so unless there's other questions, I'm done.
Denny? Councilor Denny, go ahead.
Just one thing to add to the town managers. The fire departments you didn't mention are involved with the active shooting situation, and you only mentioned police and EMS, but the fire departments are also involved.
Yep, I never leave them out. We have a collaborative effort with them. They were involved. We did a three-part training culminating in the officers being trained. The first 2 parts involved also the fire departments. We also have a tactical EMS program. We're working with the fire departments to assist us. God forbid there would be an active shooter scenario anywhere in town to augment and help as supplemental first responders. So we have a very healthy relationship with the fire departments. I thank you for reminding me.
Anyone else? Councilor Crissati.
I just have one further question in regard to, the situation that happened last week. I had a few phone calls that did come to me in regard to like area businesses being notified of the situation around town. Was there a robocall that did go out?
Yes, they did, and we can get more specifics, but they did in Everbridge within a quarter of a mile. The police department determines under their policy and protocol who it goes out to. It included Town Hall. We run a lockdown. I will just say, unfortunately, from these type of situations, the silver lining is we learn a lot for training and how to do it better next time. So if they have any concerns or somebody didn't receive a call, then we would like to look at that. I will also inform the council that based upon your funding, the town safety officer, we have hired a police officer, a very, very well-credentialed, exemplary woman who is going to be starting April 8th as the town safety officer, and we'd already talked about tasking her with doing drills in our buildings, coordinating with the school safety officer, and doing a lot of things within the town in addition to workplace safety and OSHA. So that's something she will be tasked with, and I'm glad it's a good addition. I thank the council for supporting her hiring, and I think that that's going to help us quite a bit in coordinating some of these efforts going forward.
Okay, thank you.
You know, I think, Chris, on that, though, I think the positive of how quickly the chief was in contact with the schools and doing the procedures that needed to be done. You know, the schools quickly went into lockdown. I don't know if you just, not without getting into specifics, how quickly the coordination, yes, we can improve in certain areas, but also, I mean, things happen pretty quickly. So I don't know, I mean, just from a perspective, how closely we're working with the schools and the police department, you know, what happened on that day. Yeah, which I think some of the positive, meaning.
Yeah, I think it was successful. I think we can always learn. We have a very good communication with the school system, the chief, the superintendent, our officers. We have SROs in the school, so they do act, you know, quickly, and sometimes out of an abundance of caution, even though they're outside the range. Better safe than sorry, and that's something it's a work in progress. It's something you continually have to work at because knowledge of that sort is perishable. That's why you have to do the training and you have to keep up with it, and that's something, as I said, which is always in the forefront of our minds.
Moving on to item 10, town attorney. Thank you, Chris.
Good evening,
Maria?
everyone. I don't have a formal report, but to Councilor Sferrazza's question earlier, we will keep an eye on the Connecticut legislation and see whether there is any way that the sale can be banned if that's the council's wish, but we'll keep an eye on the legislation and report back.
Sorry, go ahead, Chris.
One thing, if I could, with all the questions I had forgotten to mention, at long last, I don't want to jinx it, but as the council, keep your fingers crossed.
You were going to leave it alone.
Well, I think we should say, though, that, you know, we're on because it's either going to be yay or nay, but the governor has promised a skinny diet on bonding, but I think appropriately, given the contractual obligation of the state, they are going to have their first meeting of the bonding commission under this governor. It is tomorrow, and our $2.5 million reimbursement from DOC for the upgrade of the sewer facility is on. So keep your fingers crossed. We're very optimistic because I think different than other things that are more discretionary, this is an obligation of the state. I think it's a really good sign. I will just thank our state representatives. The council supported me and our staff in getting the information to them. We could get it to the goal line, but it took our state reps to push and get it on the agenda, and hopefully tomorrow they'll do the right thing and we'll have our money, which we do need for the upgrade of our water pollution control facility, which I will say to you is underway. People don't realize it. It's not the same as a school, but we had the groundbreaking in October. It's on task to be completed within the 2 years and on budget to do so, but this money will be needed to complete that, so we'll know tomorrow.
So Maria, real quick, just an update on the nutmeg. I know it's just so the public knows. I mean, it's been sitting out there for, I think the public hearing was in January.
It was in January, and originally the date that the decision was supposed to come down was April 17th. The Siting Council asked for an extension until May, and we thought it was wise not to object. We had sent a letter with the council's requests way back right after the public hearing, and the commission or the council, Siting Council, will be making a decision within the next month or so.
And just kind of a clarification for people. So back again, almost a year ago, we joined a lawsuit to sue the big pharma, or we joined a group of other towns.
Well, we told the Scott & Scott, the town of Enfield was interested in participating in any litigation. At that point, there were a number of towns that were already in the process of going forward. So the suggestion was that, and the judge allowed other towns to be able to be joined pending these particular decisions. As it was, the judge ruled against the towns, and that's not uncommon because Connecticut is one of the few states in the union that has not allowed municipalities to participate.
All right.
So at this point, we're
Right, so
kind
the-
of regrouping.
So the question was whether we would, the state would allow us a public hearing to see if they could let the municipalities sue on their own, or not let the state do it, but it never came up through the judicial committee.
Well, in terms of the legislation, that's
Right.
my understanding, that was a push that Scott and Scott was encouraging, and it doesn't look as though that's going forward based on what was reported by our legislators the last time around. But in terms of the motion to dismiss and the appeal, that's still in the, kind of in the, wending
It's in
its
the
way
courts.
through. Exactly, right, thanks.
Any other questions thank you for the town attorney.
You're welcome.
Thank you. Moving on to item 11, report of special committees. Councilor Muller.
The JFK Building Committee took Lamont's threat seriously about having a signed contract in by April 1st. We have a signed contract with JCJ. Special thanks to the town manager, finance, and the town attorney. Thank you. We also received 4 firms for the owner's rep, CSG, Colliers, Morganti, and STV. The committee ranked them, and CSG came out on top. That's later on in our packet tonight. Thank you.
It's great work by the committee, and again, now that we took it very seriously. Yep. Deputy Mayor Suzak.
Facilities did a first round of negotiations with the chosen BL for the master plan for the town buildings. We're going to meet again on Thursday to discuss more how we get scope and costs into alignment. And I guess for me, it's the question I guess I have is, we now have the security committee back, and I think, is it time for the security committee to sit down with facilities and discuss windows and vestibules, which are, those are grant-driven projects again. So I think that, we've got roofs underway. It's a little bit flexible as to what roof is next and what roof is going to be, done. But I think it's time now to start thinking about hardening the buildings the rest of the way. The schools have all been consolidated. And how do we get vestibules on these schools, and how do we get windows in? So if somebody knows anything on how those two committees are going to meet. I mean, Gary Harrison used to bring us updates, but I think it's time we sat down and we brought to this council a plan so that funding can start to be in place, because it's approximately 50% grant for windows that we are entitled to. So, and then there are other grants that I'm not familiar with that would be through the security. So time to continue hardening the buildings.
So quite, Chris.
Only because it's such an important issue, I would like to address it. I did talk to Gary Harrison this past week about that. Unfortunately, the state of Connecticut, there's been a real curtailment of the grants, initially after Sandy Hook in the years.
That's the security grants.
Right.
But the window grants still stay for us.
Right. But I was going to get to that. But in regard to those, the towns and cities that have really done a lot less than us are more eligible. We did a lot and received a lot of money, so those grants are not an opportunity. And I discussed with him bringing that to the next joint security meeting of the board and the town and the staff to discuss exactly that, what we should be doing in hardening, what grants are available, and how we should be proceeding. Even without grants, we should have a plan and continue hardening the building as we have over the last several years.
Yeah, because the vestibule at Stowe is our model vestibule, if I'm not correct. And that was done by our staff. So I think it's, the voters may have voted down that $41 million referendum, right, Joey? But it still needs to be done, because just because you vote no doesn't mean the problem goes away.
Anyone else? Moving on to item 12, old business. Appointments 1 and 2, there are none on page 1. Moving on to page 2, items 3 through 16, there are none. Top of page 3, item 17, Prison Town Liaison Committee. Do we have a nomination? Or excuse me, do we have a motion to remove from the table?
So moved.
By Deputy Mayor Suzak, seconded by Councilor Crisati. Any discussion on the motion? Hearing none, but show of hands. All those to remove from the table by show of hands. Anyone approve abstention? 9 in favor, 0 against. Do we have a nomination, please? Deputy Mayor Suzak?
Nancy Harvey?
We have a nomination. Do I have a second?
Second.
By Councilor Sferrazza. Do I have a motion to close nominations?
So moved.
By Deputy Mayor Suzak, seconded by Councilor Crisati. Any discussion to close on closing nominations? By show of hands, all those in favor? Opposed, abstention? We have 9 in favor, 0 against to close nominations. Any further discussion on the main motion? Hearing none, roll call, please.
Counselor Ungary.
4.
Counselor Bosco.
4.
Counselor Sakala.
Nancy Harvey.
Counselor Crisati.
4.
Counselor Denny.
4.
Mayor Ludwig.
4.
Counselor Muller.
4.
Counselor Sferrazza.
4.
Deputy Mayor Suzak.
Nancy Harvey?
We have 9 in favor, none against, and no abstentions.
Item 18, again, remains on the table. Moving to item B, appointments by the town manager, 1 through 12 on page 3. We have none. 13 and 14 on page 4 stay on the table. There are no appointments for council-approved P&Z commissions in item C. Item D, discussion resolution, non-union pay plan. Do I have a motion to remove from the table and move off the, Suzanne, do I have to, does the motion to remove off the agenda come after, or just to remove from the table first? I have a motion to remove from the table.
You do, if it's old business, yes.
By Deputy Mayor Suzak, seconded by Councilor Denny. All those in favor of removing from the table by show of hands? 9 in favor, those opposed, 0. 9 in favor, 0 against. So we have a motion to now, with a motion to remove from the agenda, right, Suzanne? Do I have a motion to remove from the agenda? By Councilor Crisati, seconded by Deputy Mayor Suzak. Any discussion on the motion? All I want to say is I just want to, I don't, because there's no resolution, I just want to thank all our employees. Again, if folks saw some of the earlier discussion with the health department, again, another group of our employees understanding our financial situation and taking a 0. The non-union folks deserve to be commended just as our local 1029 and the teachers before them. This is great news, and again, another example of our town employees working for the taxpayers of our town. Again, they should be commended. Roll call or just show of hands, all those on show of hands to remove from the agenda? Opposed, abstention, 9 in favor, 0 against. Item E remains on the table. You gave a brief, town attorney gave a brief update. Item F, school replacement, stays on the table for now. Won't have an update for a while. 13, new business, no consent agenda in item A. B, no town council appointment. C, no town manager appointment. And D, no appointments, council approved P&Z commission. 14, items for discussion. Item A, there's no consent agenda. Item B, no council appointments. Item C, no town manager appointments. Item D, no P&Z commission appointed council approved appointments. Item G is, again, do I need a motion just to remove from the agenda? Right, it's new item for discussion, do I need a motion, or we just?
Just a motion is fine.
Do I have a motion to remove from the agenda? Motion by Councilor Bosco, second by Councilor Crisati. All those in favor to remove from the agenda by show of hands? Those opposed, 9 in favor, 0 against. Item G is off the agenda. Items E, F, H, I, J, K, L, and M have been moved to miscellaneous. Item 15 is miscellaneous. Okay. Item E, sorry, 1 second. I know. I don't like technology. Item E, request for discussion resolution, request for transfer of funds for public works of $43,638.94. Resolved in accordance with Chapter 6, Section 8F of the Town Charter, the following transfer is hereby made. To the Public Works Grant Still Meadow of $43,638.94 from Public Works Other Professional Services $43,638.94. Certified that the above funds are available on April 8th. Well, April 8th. I think we need April 1st there, right? April 1st. We may have to make an emotion there. 2019 by John Wilcox, Director of Finance. Approved by Christopher Bronson, Town Manager. By Councilor Muller, seconded by Councilor Denny. Real quick, I'm going to make an amendment to change an under certification that's approved on April 1st as opposed to April 8th. Right, John, that's okay? I'm good with that. Amendment to change it to April 1st, made by Deputy Mayor Suzak, seconded by Councilor Muller. Any discussion on the amendment? By a show of hands, all those in favor of the amendment? Those opposed? 9 in favor, 0 against. Main motion, Chris, as
Yes,
amended.
this is a pass-through of a state grant to continue upgrading filters in this neighborhood pursuant to a 2008 consent decree with the Department of Environmental Protection. So it's a pass-through, so we can continue that.
Any questions on the amendment, on a motion as, excuse me, on a resolution as amended? Apologize. Hearing none, roll call, please.
Councilor Ungary. 4. Councilor Bosco. 4. Councilor Sakala.
4.
Councilor Crisati.
4.
Councilor Denny.
4.
Mayor Ludwig.
4.
Councilor Muller.
4.
Councilor Terrazza.
4.
Deputy Mayor Suzak.
4.
There's 9 in favor, none against, and no abstentions.
Moving under miscellaneous, item F. Discussion resolution to approve the proposed pay rates for summer, seasonal, and temporary employees. Resolve that in accordance with Chapter 5, Section 10, says 14, right? 1014?
Yep.
Of the Town Charter, the Enfield Town Council does hereby adopt the pay rates for summer, seasonal, and temporary employees in a Recreation Division effective June 1, 2019. Attached is the summer, seasonal, and temporary employee pay rates for the Recreation Division effective June 1, 2019. Submitted on March 20th, 2019 by Steve Blinda, Director of Human Resources. By Councilor Muller, seconded by Councilor Crisati.
If you have questions, Mary Keller from Recreation, which is where these seasonal increases will occur, Mr. Blinda are available. But basically, they haven't had increases in about 5 years. This is to stay competitive. It's going to be mostly offset with increases in fees of usage, as we've discussed. So it's something important. For instance, lifeguards, we bring people in, we train them, they get the degree, and then they go somewhere else because we're so much below the market price for those. A list was included and given to you to review for the weekend, and again, we recommend it. We've also addressed it in the budget for next year because this will straddle. She has enough for June, and then in the July budget, we address it and implement it and fund it accordingly if you approve it.
I don't know, Mary, if you want your call, if that was good. Any questions for Mary before we call her up? Hearing none, roll call, please.
Councilor Ungary.
4.
Councilor Bosco.
4.
Councilor Sakala.
4.
Councilor Crisati.
4.
Councilor Denny.
4.
Councilor Kiner.
4.
Mayor Ludwig.
4.
Councilor Muller.
4.
Councilor Terrazza.
4.
Deputy Mayor Suzak.
4.
There's 10 in favor, none against, and no abstentions.
Moving on to item H under miscellaneous, discussion resolution authorizing the town manager to make application and executive assistant agreement with the state of Connecticut Department of Housing. Whereas federal monies are available under the Connecticut Small Cities Community Development Block Grant Program administered by the state of Connecticut, Department of Housing pursuant to Public Law 93-383 as amended, and whereas pursuant to Chapter 127C and Part 6 of Chapter 130 of the Connecticut General Statutes, the Commissioner of Housing is authorized to disperse such federal monies to local municipalities, and whereas it is desirable and in the public interest that the town of Enfield submit an application to the state for $350,000 in order to undertake a small cities community development program and to execute an assistance agreement should one be offered. Now therefore be it resolved by the Enfield Town Council, item 1, that it is cognizant of the conditions and prerequisites for the state assistance imposed by Part 6 of Chapter 130 of the Connecticut General Statutes, and 2, that the filing of an application by the town of Enfield in the amount not to exceed $350,000 for public housing modernization is hereby approved, and that the town manager is hereby authorized and directed to file such application with the Commissioner of the Department of Housing to provide such additional information to execute such other documents as may be required by the Commissioner, to execute an assistance agreement with the state of Connecticut for state financial assistance, if such an agreement is offered, to execute any amendments, rescissions, revisions thereto, and to act on as the authorized representative of the town of Enfield. I, Suzanne Olnicki, Town Clerk, 2 pages. Certify this is true and the correct copy of the resolution duly adopted by the Town of Enfield at the meeting by the Town Council duly convened on April 1st, 2019, which has not been rescinded or modified in any way whatsoever, and is at the present in full force and effective. Again, submitted by Suzanne Olnicki, Town Clerk. By Deputy Muller, by Councilor Muller, seconded by Councilor Crisati. I ran out of steam there. So I was waiting for Joey to waive the reading. I was running out of steam. So this is due to the public hearing. And,
right, we had the public hearing at the last meeting. Nelson Teresio, Deputy Director, and Scott Bertram made the presentation. We're applying for up to $350,000 federal money for Green Valley improvements therein, and this is to allow them to file the application.
Any questions? Hearing none, roll call, please.
Councilor Ungary.
4.
Councilor Bosco. 4. Councilor Sakala.
4.
Councilor Crisati.
4.
Councilor Denny.
4.
Councilor Keiner.
4.
Mayor Ludwig.
4.
Councilor Muller.
4.
Councilor Terrazza.
4.
Deputy Mayor Suzak.
4.
There's 10 in favor, none against, and no abstentions.
Moving on to miscellaneous, item I, discussion resolution authorizing the waiving of property maintenance fines and liens for 3 Concord Terrace. Whereas pursuant to Chapter 14, Article 4 of the Enfield Town Code, property maintenance, the former owners of 3 Concord Terrace were cited for blighted premises and were fined accordingly. And whereas pursuant to Section 14-180 of the Enfield Town Code, the former owners did not contest their liability for the violation before a duly appointed hearing officer. And whereas the hearing officer found the former owners liable, ruling in favor of the town. And whereas the hearing officer notified the former owners in writing of such decision. And whereas pursuant to Section 14-183 of the Enfield Town Code, property maintenance liens securing the fines were recorded in the town's land records. And whereas the property has been foreclosed, and a real estate agent representing the financial institution that currently owns a property, parentheses current owner, has approached the town with prospective buyers, and whereas the current owners have requested that the town waive a portion of the unpaid property maintenance liens in order to allow for the sale of property, and whereas the above noted request pertains only to the property maintenance liens filed by per Town Code Section 14-183, and whereas the alternative to waiving a portion of liens is for the town to foreclose on a property. Now therefore be it resolved that the Enfield Town Council has authorized the waiver of a portion of the property maintenance liens on 3 Concord Terrace, and authorized that the amounts set forth in Attachment A be accepted in lieu of full payment of these liens prepared on March 20, 2019 by the Town Manager's Office. By Councilor Muller, seconded by Councilor Crisati. Councilor Denny.
I just wanted to let the public know, I asked a question today about this. This is in my district. We spend numerous times cleaning this property up, et cetera, et cetera. The neighbor's been complaining forever. There was a time you couldn't see the house. It was so blighted. Right. There's an individual that's going to buy this place and turn it over. It's not like we're given a break on all the taxes. There's a $31,000 lien that we're going to collect. It's probably about half of what they really owe us. But in my opinion, it's the best thing to do. We're getting half of the money to recoup from what we spent there and put this property back on the tax rolls is basically the thing. Thank you.
Thank you, sir. Councilor Bosco.
I'm going to vote in favor of this, but I'd like to add a little caveat to it. I don't know if it's too late for this one, but on any future ones that we have, or even possibly this one if we can, any fine that we waive, especially now going into a blight board, should come with a specified time that this property becomes in compliance, and it should maintain compliance for a specified amount of time. Because nothing's going to say we're going to, and I'm sure it's not going to happen, but nothing's going to say that we're going to waive these fees on this property, and the new owner run down and get a building permit and don't commence any work, or take a year or 2 years to finish it and just keeps renewing the building permit every year. So, like I said, I don't know if it's too late for this one, but I think all future ones, we ought to start looking at, there's a certain amount of time that property has to stay clean, and that's no matter which blight one we do, because it's easy to come in compliance, get rid of the fine, and have to start all over in a month. So that's my opinion on this. And like I said, I don't know if we could do anything on this one, but if not, for next ones, I'd like to see that in the resolution.
But Chris.
Oh, I think this is something that will be addressed with the Blight Board that's going to be meeting. You're going to be making appointments this evening. You'll be working on criteria with the town attorney to address those kind of matters. In this one, they have a short time frame. They're going to sell it. I'll just state that these aren't for past due taxes. This isn't an amount of money that we paid either. This is just the accrual of over $60,000 in blight fines. They have brought it up, as the councilman said, and we're going to collect over $31,000. That's a pretty amazing result to be put into the town general fund. I would also say it's difficult, and the town attorney will have to look at you during the blight review, but for them to buy the property, they've got to do it free and clear. You've got to release it. So to say to the new owner that you're going to be held responsible for the acts of the old, if it's up to speed when they buy it, it's kind of difficult to do, but that's something I'll leave to her to discuss with you with the new blight review committee. But I think this is a very good result, and I'll just add that this is a federal government that owns this, and
it's a HUD property, right?
Yeah, if they didn't want, and if they didn't want to pay it, they wouldn't have to pay us anything. So $31,000 is a very good result.
No, I'm glad what happened. It's just, and if we can't do it to the next owner, at least the people that keep their property, any fines we resolve, there's got to be like a period that they don't recause the problem. That's all. That's what I'm saying.
Understood.
Anyone else? Hearing none, roll call, please.
Counselor Ungary. 4. Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
4.
Counselor Denny.
4.
Counselor Keiner.
4.
Mayor Ludwig.
4.
Counselor Muller.
4.
Counselor Sferrazza.
4.
Deputy Mayor Suzak.
4.
There's 10 in favor, none against, and no abstentions.
Item J, discussion resolution, a resolution setting terms for the Blight Review Committee. Whereas the council has amended Town Code Sections 14-171, ETS sequence commonly known as the Property Maintenance Ordinance, and established a Blight Review Committee, BRC, by resolution number 4887. And whereas the BRC is comprised of 5 members appointed by the town council, 3 of whom shall be residents of the town of Enfield, and 2 of whom shall be Enfield town councilors, 1 Democrat and 1 Republican. Now therefore be it resolved that the initial appointment shall be 1 member for a term of 2 years, 1 member for a term of 3 years, and 1 member for a term of 4 years. Thereafter, any reappointment or new appointment shall be for a term of 2 years. By Councilor Muller, second by Deputy Mayor Suzak. Think it's self-explanatory, but anyone have any questions? Yeah, I think we're good. Roll call, please.
Counselor Ungary.
4.
Counselor Bosco.
4.
Counselor Sakala.
4.
Counselor Crissati.
4.
Counselor Denny.
4.
Counselor Keiner.
4.
Mayor Ludwig.
4.
Counselor Muller.
4.
Counselor Sferrazza.
4.
Deputy Mayor Suzak.
4.
There's 10 in favor, none against, and no abstentions.
Under miscellaneous, item K, discussion resolution, a resolution authorizing the town manager into lease agreements. Resolved that Christopher W. Bronson, town manager, is empowered to execute license agreements for the use of room D218 located at the Enfield Annex, 124 North Maple Street, a sample of which is attached here too, prepared by the town manager's office on March 28, 2019. By Councilor Muller, seconded by Councilor Crissati. Again, I don't know if you want to brief, but
Yeah, briefly, this is Room D in the town annex. It's like Area 51. Mr. Crissati had come forward, and others. We have some groups, nonprofits in town that would need a small area. The senior center, they needed it for a cabinet. The Daughters of the American Revolution need it for a cabinet. So we have a stringent policy. We're not expanding the use there. because it's a well-used building, but we did find this area close to the entrance. This is a license agreement. I thank the town attorney. They did a tremendous job in writing this so that we can allow people to use it. They hold us harmless for small items during regular business hours, and it will accommodate those nonprofits that need an area for space that's in a protected building that we can provide at no liability to us. So I think it's a good relationship, and this allows me to sign it under these conditions with them so they know the rules. So I would ask that you approve it.
No, I agree. I think this is great work by the town attorney. This is basically dotting your I's and crossing your T's. Very well done. Roll call, please.
Counselor Ungary.
For.
Counselor Bosco.
Against.
Counselor Sakala.
For.
Counselor Crisati.
For.
Counselor Denny.
4.
Counselor Keiner.
For.
Mayor Ludwig.
4.
Counselor Muller.
4.
Counselor Sferrazza.
4.
Deputy Mayor Suzak.
For.
There's 9 in favor, 1 against, and no abstentions.
In miscellaneous, moving on to item L, discussion resolution referring the proposed conveyance of 98 Prospect Street to Planning and Zoning. Whereas the town of Enfield owns 98 Prospect Street, and whereas the town intends to convey the land to Kelly Fredette Lumber, Inc., and whereas the town council must refer this proposed conveyance to the Planning and Zoning Commission for a report in conformance with the requirements of Connecticut General Statute 8-24. Now therefore be it resolved that the proposed conveyance to 98 Prospect Street is referred to the Planning and Zoning Commission in conformance with the requirements of Connecticut General Statute 8-24, prepared by the Office of Community Development on March 28, 2019. By Councilor Muller, seconded by Councilor Sakala. I mean, this is great news. Again, another moving projects forward that we voted on, I think, over a year or so ago.
Yeah, we'll have more information. This is just to refer it, but I think it's a really good result. It was something that had languished. It's benefiting the town and also a local business that's committed to Thompsonville. So we'll have more specifics after we get back their referral for your consideration. But I think it is. It's another real step and progress moving forward in the town and economic development.
Any questions for Chris? Hearing none, roll call, please.
Counselor Ungary.
For.
Counselor Bosco.
4.
Counselor Sakala. Counselor Crisati.
4.
Counselor Denny.
4.
Counselor Keiner.
4.
Mayor Ludwig.
4.
Counselor Muller.
4.
Counselor Sferrazza.
4.
Deputy Mayor Suzak.
For.
There's 10 in favor, none against, and no abstentions.
Moving on to miscellaneous, item M, discussion resolution authorizing the town manager to enter into an agreement for owner's representative services for additions and renovations to John F. K. Middle School, whereas the JFK Middle School Renovation Building Committee, also known as the committee, as charged by the Enfield Town Council, has completed its review process for owner's representative services for additions and renovations to the JFK Middle School, and whereas the committee has recommended Construction Solutions Group, LLC. Now therefore, be it resolved that the Enfield Town Council hereby accepts the recommendation of the committee, and be it further resolved that the council hereby authorizes the town manager to enter into and amend the agreement for owner's representative services for the JFK Middle School renovation project, which agreement and any amendments thereto are subject to review and approval of the town attorney, submitted on March 29, 2019 by the town manager's office. By Councilor Muller, seconded by Councilor Crisati. Again, this is, I mean, again,
Just
great
briefly,
news.
I'd like to thank the committee for all of their work. I would also like to specifically thank the town attorney's office and the finance office. You know, we were told an April 1st deadline. There's tremendous stress in having to review very, very important, complicated documents under such a deadline, and they did it with incredible skill and patience with me, because I am on them and calling them and holding to account, and I apologize for that, but it's only because the stakes are so high. If we don't get it in by the 1st, perhaps we would lose the funding. So I apologize to them for my impatience. I thank them for their professionalism in getting it done. And lastly, I guess I don't know, like a candidate on an apology tour. I apologize to Mr. Cycli. He's here because these are always coming in under the wire. It's the last item. He's here for questions. This is about the 2nd or 3rd time he's waited to the last item and not been called up.
So you're
but this
welcome
is
to
his
club,
company,
sir.
and if he has anything to offer. Well, but he still has to be here at 9.
Right.
Thank you,
Gotta
Chris.
be at the end. Sure, you're welcome.
Welcome, sir. Name and title and anything you want to.
Chris Cycli, Vice President, Construction Solutions Group.
And I think, only thing, I don't know if anyone has any specific questions? Councilor Sakala? All I want to say is I think this is, for me, it's fantastic. We listened to what was being told by, again, the state, who says that possibly the funding was at risk. Not saying it was, but possibly. This committee did its job. Randy and Randy Daigle and his team. They met on a Saturday, spent all day, went through to get the initial architect, and then the committee followed up, recommended owner's rep to have it submitted by today. The contract, I've had to review contracts within 24 hours. I know how stressful it can be, Maria. And again, I'm not a lawyer, so I can imagine if I was actually a lawyer. And you're right, every piece of language is important. So thank you to you and your staff and to John and the town. Again, whether it was an idle threat or it was a legit threat, the town took it seriously, from the committee all the way to the staff and to the council and our representatives. I think that's why, for the public, the governor says, rightfully so, we're on a debt diet, which I think is the right thing to do for the state, so I agree with him there. However, this was an approved project by the voters in last year's budget, per the referendum. And the edict or the idle threat was, if you don't have a signed contract with a architect by April 1st, you may possibly lose your reimbursement. I think, if I'm paraphrasing correctly.
No, you're correct, Mr. Mayor. And it wasn't just this document, it was for CJJ or JCJ that they also had to have by last Friday. The turnaround time was only a couple of days. Also the RFPs to do both of these. So the stress on these two offices was incredible, and I thank them for doing it. And again, I apologize for me being a little impatient with them for it, but we knew what the stakes were. They always come through, and I just want you and the public to know what an incredible job they did and what a great staff that you have.
So we're expecting big things from you folks. All right, I know you'll come through. Deputy Mayor Suzak.
I guess you should also know that, you guys were like way ahead, so the state did waive the interviewing process. That did not have to go to interview because there was such a differential that there would be no point spread. And we do in Enfield use the state QBS method, and that's why we get our reimbursements. And, CSG is new to us from when Art Pomegrantz left due to health concerns. He had been our owner's rep. But everybody has to understand that when we do these, we have to follow the state guidelines, and because we're following the state guidelines, these services do come under the reimbursement. So we don't, although our staff does work with you, we're not overworking our staff on these projects. And we prefer that facilities overwork our owner reps to get our roofs done. But I think, we have a really good system, and I think, we have to start putting that down in real writing as to how we move forward with getting everything. Because it's important that the state be involved, especially with the schools, that, they are the controlling factor. And we need to come up, step to the plate and fix our buildings. Thanks.
So you have the floor. Any words of wisdom? April Fool's joke? You got it.
No April Fool's joke. I'm happy to be a part of the team. I'm glad that we were selected.
Right, and I know we look forward to working with you folks.
Perfect.
Thank you very much for sticking around, and want to make sure you at least be able to speak. You do stick around a lot of late nights.
He's going to wait for the vote.
Roll call, please.
Councilor Ungary.
4.
Councilor Bosco.
4.
Councilor Sakala.
4.
Councilor Crisati.
4.
Councilor Denny.
4.
Councilor Keiner.
4.
Mayor Ludwig.
4.
Councilor Muller.
4.
Councilor Sferrazza.
4.
Deputy Mayor Suzak.
4.
There's 10 in favor, none against, and no abstentions.
Thank you, sir.
Thank you, Chris.
Item 16, public communications. Would there be anyone who'd like to speak for the public this time? Bob. Welcome, sir.
Can you hear me?
Yeah. Yes.
We also should check
It's not.
There it is.
There you go.
We also should check these on Hazard Avenue and Elm Street, the sequence of lights, red lights, because if you hit the first red light at Middle Road in Palumbo, you're going to hit every one. Cars coming out the side from the shopping center, they're not even up to the stoplight yet, and yet it turns red on the main road. So one car holds up 40 cars for 1 or 2 minutes because you got the green. So I think we should redo those lights or have the state check them because it's causing a lot of traffic jams. As far as marijuana, and marijuana is not the term. That's a slang term that came in the 30s. I talked to many medical doctors about it, many pharmacists. Smoking and alcohol are far more dangerous. Marijuana has a medical positive effect on bodies. It helps addiction, opiate addiction. There's a lot of positives about it. And if you would be surprised, the marijuana use in Enfield is very high. Because I talk to maintenance men that go in these apartments to do repairs, and they know who's doing marijuana and who's not doing marijuana. And he said you would be surprised how prevalent it is in Enfield. And it's probably the biggest secret there is. And I got to give Chris a new nickname, Chris Fast Track Bromson, because of the copier machine. So I want to thank you, Chris. It's been it's a highly used copier. They make thousands of copies every day, and copies are terrible right now. In fact, I had to pass out. I'm going to pass it out next time. You'll see the old copy machine, the bad work that it did, because you can hardly. Huh? No, I don't want that machine's ready for the junkyard. The two machines. So I'm glad you're doing it. I hope it passes in the budget because it's needed over there. You can give up a dump truck, Joe, for the copier, okay?
Thank you, Bob. Anyone else like to speak for the council? Anyone else? I declare public communications closed. Any councilor communications? Item 17. Hearing none. Item 18, a motion to adjourn by Councilor Ungary, seconded by Councilor Denny. All those in favor? Aye. Opposed? 10 in favor, 0 against. Thank you, everyone. Good night.